All right, all right. Y'all know what time it is. Well, well, well. We are back for another live open court discussion in the Counselor's Corner, streaming live on Facebook and YouTube. I am your host, David Lorenzo Glover, aka the Controversial Counselor, and joining me is my co-host, Herb Lewis, the Big Bad Wolf. This past Monday, we discussed the topic social contracts. Mm, mm, mm. People weren't trying to hear. They don't like the word contracts because that means you're binded into something. So even if this is an unwritten contract, it just still don't set in well with people. But we tackled it, and I'm sure we're not done with that conversation as well. But tonight we will be discussing the topic mental health. Where do we go now? Do we care like we should? Many of us care and know many people that are struggling with the mental illness on a daily basis. But the pressing question I always have is how can we help others who often refuse to help themselves? And I say that in a mannerism of as we get older, and you may have people, friends, um, family members that's struggling through mental illness or alcoholism, depression, drug addicted. How much time can we invest in it? How much time can we really invest in it? Again, as we get older and we have our own issues. So a lot of times it seems like maybe the mental ill is treated like the black sheep and people just keep it moving and handle their business. But I guess after a while, how much do you have to put into it? As you get older, you got job responsibilities, you have children, you may have grandkids or different things that occupy your mind along with other extracurricular activities. So I don't know. We're certainly going to talk about it and see how this pans out. So let's discuss this very important subject as we aim to build better relationships at home to build better communities. Please like and share this video and don't forget to subscribe. Oh, that's a lot. To subscribe to my YouTube channel, The Controversial Counselor. And here we are tonight, man. So it's Monday night. Mondays is always kind of, it depends. I mean, I can't say that these Mondays have been stressful since I returned back to work because, like I said, it's only a small pocket of kids. So, but I guess the unknown, like everything seems to be uncertain. You can't get any answers. We don't know what's going on. Numbers still climbing, but yet and still they're talking about, hey, let's have the kids come there 4 days a week now. I mean, that's partially because many of the kids wasn't doing anything this past year or so while they were at home virtual learning. So it's like everything is makeshift. So I'm just going with the flow, and the flow isn't my normal flow that I'm used to for like 25, 26 years. But I know change make you grow and all that stuff. But damn, can I get 50% of what things used to be? And you don't go from 100 to like 15, 20%. Like this is just wow. It's wow. But no, I'm not gonna fall into no deep depression over it because when one thing suffers in your life, then you find other avenues that you can find passion and pleasure, and you focus on those. So that's where it's at for me. Herb, man, fires. What's going on, man?
Mondays, man. Mondays are when I look back on the prior week and I compress everything that has occurred. This past weekend, was it was one of those jotted down in my books and write about it later things. I just had a probably almost an hour long conversation with an old college friend of mine, and I was running down the things that happened, at work in terms of just a treatment, that the staff has to endure over the last year plus, ever since COVID is hit, and it's been across my industry, which is tourism, travel and tourism and hospitality, that we've been having to deal with just some rather unsurly people, man, and just the verbal aggression, the mistreatment, the accusations, it all has us, stretched, beyond just our every normal day, issues that we would tend to have in the industry. So it becomes more important, at least for us, to have avenues where we can, kind of offload, the things that we've been enduring, so whether it's between each other, where we tell our stories, but sometimes it seems as if things are localized between us and guests. And then when we come to find out that it isn't, we just say, so it isn't just me that's having these issues with these particular people. So, I think your coworkers, families, whether you blog, you write, or for some people they have these groups that they can go and they can release this type of pressure, because eventually it gets to a point where if you don't have an outlet, like you said, you start to fall into a state of depression. And if you don't, you don't have a physical regime in which you work out, you end up just cannibalizing yourself in the way you feel. So you no longer feel as if you're relevant or you're important, and you tend to self isolate because you don't know anybody else that's in doing some of the same things you are. Me, I love to go bike riding. For me, bike riding is cathartic, and especially when I ride along the river. I go out along the falls, and I'll go out towards North Tonawanda. I don't ride that way as often as I used to. I used to be able, put in about 20 to 25 miles over rugged terrain in about hour and 45 minutes. I used to give myself a 20-minute break in between, because I was riding back into the wind, and that was, it was a little tougher than riding with the wind. So I always tell people, find some avenues to where you can vent, so you're not allowing yourself to be consumed by the everyday problems you have, whether they're problems at home, problems at work, or just whatever it is that you have. Just, you have to find some way to decompress, so you're not consumed by the everyday rigors of your life. And everybody doesn't have the same rigors. I know when I come home, generally there aren't any issues. Everybody doesn't have that. Some people have to deal with the spouse that, when you come through the door, you have to deal with this person's behavior. You have to deal with this person's lack of academic achievement, or if you have a child that's special needs. All those things pull people in different directions. So you have to carve out a niche somewhere, somehow, to where you can just say, okay, you know what, this is the time for just me. I don't have to deal with this issue. I don't have to deal with this person. I don't have to worry about bills being paid. I don't have to worry about any of this stuff. I can just sit here and be normal.
All right. So we have a few of the ladies who joined the panel tonight. Good evening, Anita.
Hi.
Hello.
Hi,
Good
everybody.
evening, good evening, Lakia. Welcome back.
Thank you. Good evening. How's everybody doing? Glad to be back.
Everyone. Doing all right.
Good. Good evening, Rebecca. All right. So, when we think of this subject, and I know doing a write up of this, heard one of the questions, but I'm going to let the ladies get a chance to speak. I know one of the questions is, where do we go now? And do we care like we should? Which is deep questions, like where do we go? And also, do many people care? Because a lot of times people just don't care if they feel like they can't can't drive home a point or really truly help. So they just tend to deal and focus on themselves. So it's just a dilemma we got going on, and as we can see throughout the country, all the things that's going on, it's like getting bad out here. Like earlier today, I was just reading maybe a 12-year-old. I don't know if they shot a 13-year-old, like maybe about an hour away from me in PG County. And I'm like, what the hell? Like, what is going on here? Like, it's just so much going on, but we'll get into that as we go along. So I'm gonna start off with you was the first one out here. Anita, when you think about mental health and mental illnesses, what's your take on that? How has it impacted you, or what's your overall thought process?
My overall thought process is that we need to be more of a community together and figure it out. Because obviously something's going wrong with these young people, and maybe it's more publicized because of social media. But me being in the military, we have a strong support group. And it used to be, back in the day, it used to be a very big stigma to go get help. Nowadays, it's not. And same thing goes with like my grandma and my mom's age. It used to be a very unheard of thing to go to counseling for anything. You would just like kind of sweep it under the rug and deal with it. So I think that has like some repercussions down the generations. Not only that, but people forget that it, mental health and trauma go together. So if somebody was sexually assaulted, like yeah, you can treat that physically, but also it needs to be addressed mentally too, because there's a lot of ripple effects can go along with not being treated as a whole. You understand what I'm saying?
Mm-hmm.
Yeah. So I think we, as a community, as friends, as acquaintances, we can do a better job at talking to each other. I know in Canada they have a Let's Talk Day in certain colleges. I don't know about your school, but they have certain days, mental health days, where people talk, and it's not frowned upon to talk about these things. I think that's where a lot of the society has gone wrong, is making it something that's bad. Like I have PTSD. Okay, I was in Iraq. I was in the army for 12 years. Everybody knows that I have PTSD. So in the military, we address that. As veterans, we address that. We have a strong support network. But even so, sometimes I get in my rut. I don't want to talk to nobody. So the people that know me know if Anita's having a bad Iraq day, something's going on. So um, there's that. There's my take on it.
All right. Lakia.
So what's my take on mental health?
Yeah, mental health, your overall take on it, and just whatever your thoughts is when you think of mental health and mental illnesses.
Well, I think that it starts with ourselves first when it comes to mental illness and mental health, and making sure that we're right, we're centered, and we're in a good place. I think really before you can help anybody else. It's like for me, I used to work in mental health for 15 years. I wasn't a counselor, but you would think I was after all the years of working there. And being in that environment showed me that it was important for me to get my mental state in order. And when I began to work on my own mental health, it trickled down to my children. So I believe a lot that's going on, my own opinion, is that people are not dealing with their own, and it's trickling down to their children, and it's a continuous vicious cycle. Not that things are not going to happen, but for me, I had to begin fasting. I fast on a regular basis, and I say fast because in the past, actually for the past couple of weeks, I haven't, because I wasn't feeling good, and I just, so I wasn't fasting, but I usually fast 3 times a week, and that actually is to help me to have self-control over my mouth, self-control my thoughts, self-control over, anything that's going on in my life. It helped me have self-control. And it got easier. Like, the only thing that I can say that I fell off at when it comes to, like, some people that gets close to you, but when it comes to people, I've shared this before, like, you just noticing if you have road rage, if you get angry with somebody so quickly, if you're just not operating in patience, like have no patience, your patience is short with people. When you're working with individuals, you have to have patience. That's all mental health. You have to be loving, you have to be patient, you have to be kind, you have to be long suffering. All those things have to go with mental health. And if you're not operating in those things, then I feel like that's where mental health starts. It starts with us. And I can say, as I got myself centered in a good place mentally, it trickled down to my kids getting into a good place mentally. So whatever's going on in this world, and it's crazy right now, I do believe it's because we have to first acknowledge what we need to get intact, and there's nothing wrong with getting counseling. Counseling is, you need somebody to talk to. You need somebody that's a outsider that's outside looking in, that can help you see yourself for who you are, especially if you're in denial about who you are. So it's something that needs to be addressed much more personally. And I think that's where it'll help our communities much better.
All right. Rebecca.
We touched on this last week when we were talking about who needs counseling and all that, and I brought up mental health and said that it's real, and it is. I still believe that mental health, people see it as shameful. They don't get help, which is why you see all these people out here doing all these abnormal things. I'm a firm believer that everybody needs counseling. Everybody should have an unbiased ear to talk to about the things that bother them, whether it's chronic or acute. It's always nice to have an unbiased ear from someone. I think this society makes people feel ashamed to admit that they have a problem, a serious problem, one that requires therapy and or medication or hospitalization or anything like that. A lot of people don't realize that in those acute states that that process should take over a year to resolve itself, or at least to get you back out into the community so that you can function. I think people also don't realize that those psychotropic medications that most people take leave them feeling so numb that most people with serious mental illness, they won't take their medications, or they stop taking it once they feel better because they think that they're better, and they relapse. I think that there are a lot of people suffering from diagnosable mental illness, not just feeling blue because you lost your job or your cat died, or the things that should make you sad naturally, but chronic reoccurrent episodes of depression or anxiety or schizophrenia or whatever the case may be, and they're walking around here among us. And when we see these people act out, the first people say is they crazy, which is the reason why people will not go get help, because they don't want that label. They ask you that stuff on a job application. Nobody wants to fill that in. Nobody wants to have to fill that in. It stays on your medical record for life. As soon as you tap into that with your insurance, it will always be there. And I think people are just afraid to admit, and then there are some that are just unwilling to get help, and they have to be forced, into treatment. And she said that she thought that that trauma and mental illness go hand in hand. I agree. Also, drug abuse, alcohol abuse, all those things go hand in hand with mental illness. So, I think it's a real problem in this country. And until somebody steps in and they really do something about it, they make treatment facilities that really work. This is always going to be an ongoing issue in this country.
And one of the things, and I always kind of joke around with my colleagues because I tell them, and I probably said this before on here, that schools are not schools anymore. Schools need to be more community based. That if I was somebody like Gates or Warren Buffett, I would have a sample school that would have every sector in there. It would have mental health counselors. It would have certain schools would have the wing of the school would be like for homeless parents and kids to stay there. I would have an overnight, like a shift working where the cafeteria is open. I would have a representative from the Department of Motor Vehicles and somebody in there from social services, like a one-stop shop, because truly that's what's needed. Because when they come in there, you see the distress on the parents, and sometimes it's not even easy just to register your kid when you move somewhere else, and it's just be a lot going on, like the things that they need and the things that they say. And I feel like if every school had those elements, it would make things somewhat better. It wouldn't solve everything, but it would help out a lot in those terms, because you need a place that is like a hub that you can get not every essential need, but you can get most of the things you need done right then and there. So I think someone needs to develop a different model for schools, because this model that we got going on right now ain't it. It ain't it.
I want to follow that up, and I'm going to direct this question more to Rebecca and to Anita, because Anita, I know you're former military, so you have an insight, and Rebecca, because you're in the medical field, I think you guys are probably better able. And I don't know if did she disappear? Oh no, she's still there. I'd miss it because too many people have joined the panel at the same time. I want to direct this to you guys, and David, you can also chime in too. Do we think that enough money or funding is allocated to mental health in the way that it should be, or in the way that would make it more effective? Because I know the stigma is always going to be there, and I think what some people don't know is if you're ever diagnosed with a mental health issue, that's one of the ways they can actually bar you from voting. So I think that also might play a role into some people refusing to actually seek the coverage. But I want to direct that question to at least Anita and Rebecca, because like I said, Rebecca's in the medical profession and Anita's former military. So do you guys think that there's enough funding allocated for this type of issue?
Here in Texas, as far as the VA goes, I would say that our VA does. If you're willing to walk into the VA, you can get whatever you need. All of our veterans, that's all I ever hear. If they're willing to go there, they can get whatever they need. As soon as they step out of the VA, they get lost. We have more homeless people literally circling the VA than any other location in Dallas. And Dallas has a lot of homeless, and they're all veterans, just wandering the hell around looking crazy because they weren't they can't get the treatment that they need on the outside. They have to go inside. As far as mental health overall, I think the funding is there and appropriate. I just don't think it's being allocated appropriately. You have a lot of facilities that it's like being in an acute care setting. They're trying to get you stable so that they can get you out. So they can stabilize you, keep you for 7 days, 2 weeks, but then when you leave, that's where the problem begins, because these people want to go home. And again, like I said, true treatment, especially for those types of things, even alcohol and drug abuse, it takes over a year, you know, to manage these people properly, to get them back into society so that they can function. And even with that being said, they're supposed to have a place that they can go either daily or weekly to check in and to get more therapy, have group sessions, manage their medications. It's so dynamic trying to help these people. And usually most of your homeless, not all of your homeless, but you can see, you can look at some of them and tell. You can just see it in their eyes. Others, you know, it's just a choice. And then you think about all the people that are walking around with mental illness and they look perfectly fine. You know, as a nurse, I think the biggest challenge for me was dealing with a sick mind and a healthy body. I'm used to dealing with a sick body. And so you see people looking just like me, exactly like me, but the thought process that's going off in their head is so abnormal that you would know it. And they learn how to mask these signs and symptoms, and they walk around as if everything is normal and things are not. So no, I think the money is there. I just don't think they're utilizing it properly.
When you say they're not utilizing it properly, properly, in what ways could they better do that? I know you mentioned follow up.
It's like when they were on that whole big thing about defunding the police and everybody was up in arms. One of the things they wanted to do was to take wellness checks out of the hands of the police and put it into the hands of social services where it should be. Not that the police
Right.
shouldn't go because, you know, something could happen to just a layperson, you know, a counselor, a psychiatrist, a doctor walking up and knocking on somebody's door and they're actually in there having a psychotic break. You could lose your life. So the police is necessary, but the lead should be social services. So, and I say the money is there, it's just not being allocated properly. They're putting this in the hands of the wrong people. And sometimes it's put in the hands of people who are just out to make more money. Some of these acute care facilities, again, they get you in there, they get you clean, you know, they get you stable, and then they throw you right back out. And we used to call them frequent flyers because at the same time every month they would be back as soon as their check ran out. They'd be back inside rehab, you know, because you got a place to sleep. We're going to feed you. We're going to talk to you. And you can't really they have rights. You can't force a patient into therapy even when they're there. You can't force them to take their meds, although we can take you to court and hold you there. But you have to want treatment also. And some people are in such a state that they cannot make that decision for themselves, or they fight the decision, even though we know it's best for them. For somebody to tell you, no, I don't want to do that, you have to respect that. And at the same time, it's like watching somebody fall off a cliff and you're saying, give me your hand. And they're just like, nah, you know, it's the right thing to do, but they won't do it. So mental health is very dynamic because trying to speak up and advocate for someone that doesn't want to be advocated for it's a legal process. It's very hard to do. And some people are just in it for the money and not the actual true treatment and trying to get people well. And then you have people who know how to play the system. You know, everybody wants to be crazy when they're up for a murder rap. Anybody who can be crazy is going to be
Yeah.
crazy. And then you have
Yeah.
some people, like I was saying last week about that mom who had their kids up in the attic. When you really, really think about it and break it down, and I don't know this woman, I don't know what happened, but who wakes up in the morning and says, I'm going to go to work and then I'm going to come home and I'm going to starve my kids? That's not a normal thought process. Something's not right there. And not to say that she doesn't deserve jail time, but when you really think about it, those are not normal thoughts. People who run out and just kill people, sweeping, that's not normal. Even if they are evil people, those are sociopaths, and that's a mental illness. So mental illness is very dynamic, and I think if people took the time, or the government, because that's where the intervention really is going to come in at, and really thought about what it's like to be mentally ill and allocated those funds to the right places, and then held facilities accountable for the treatment that they give, and then hold the patient accountable for the treatment they are to receive and to maintain, we might get a better result. I don't think it'll ever be 100% perfect, but we might get a better result. And they need the support, whether it's from the family or the facility.
Just
I
maybe, and I
think too
want
sometimes part of the problem is you can't ask a sick mind to behave like one that is not.
Thank you.
By
Until
that,
they get treatment.
when
Right.
even then, because they give short-term treatment and expect long-term results. Like you were saying, for the people that's out on the street, one of the reasons why they don't return is because a lot of them, hey, I'm not gonna catch a bus, do this, do that. I think, transportation might be an issue. So, maybe there needs to be a courtesy van, a bus, or whatever that picks you up from where you are and takes you. There's so much entailed with that, and there's
Yes.
nothing that's one size fits all.
They
Ever.
do that here in Dallas. They will. The facility that I worked at, when they discharged, they picked them up, they dropped them off, they fed them, but even still, you have to want to do that. So you're right. It is so extremely dynamic. And you're right. Trying to tell a sick mind to behave is like trying to tell a 2-year-old to go sit down.
A doctor
The
once
attention
told
span
me,
is that of an ant.
I think
well, they
here in
once told
Western New
me
York,
this is how I want you to, I'm sorry. I
Go ahead,
once
Anika.
was told what someone that I was helping out, like you have to, we people that don't have that same problem have to understand some things about the way that they view the world. For if you take a full length mirror and slam it to the ground and pick it up, the world looks like that shattered glass to someone whose mind is not correct, and they have to figure out how to put the pieces together just to view things. It's like a kaleidoscope almost, where what you're viewing literally changes in front of your eyes. So then you're stuck with, what am I to do? So it's a whole entire big issue. Some things present as children, what you have a better chance of trying to teach them the right things
Yeah.
as children. And some things present in teens, and some things present later. So if you're 30 years old and now you're exhibiting behaviors brought on by whatever, now you have a harder time of trying to teach them or to guide them or to assist them. The thing that we try to do as people is save them from their actions. And so a lady that I was talking to that is struggling with some things in her life, her mental health, saying, listen, we don't want you to save us from our actions. We just want you to love us through them. And I think sometimes they take that human aspect out of it because you think that their mind is not stable, they have nothing to say, or whatever have you. But the fact of the matter is they still want to be treated and respected just like everybody else does.
Go ahead,
My
Anika.
thing. Oh,
Hold
go
on.
ahead.
Yeah, I
in
wanted
West
to go ahead.
in Western New York, I don't think they do a good enough job with us veterans, even Rochester area, with our mental health. I know when I moved back here from Texas, I was in Temple, Texas VA. It was great. I moved back here to Buffalo. I have to wait so long for one appointment, so long to get a provider for counseling, and then it's not as consistent as it needs to be because they're short staffed and short handed, and everybody they're doing the push. Well, they were doing the push for people to get out at 15 years, doing partial retirement. Yeah, they were doing that in, let me see, 2010, I think. Yeah, they started doing that with certain ranks and certain people in the military. And I did work, this is not really military related, but I worked, did an internship with a detox center. It was a 24-hour detox center. It was horrible. I mean, I don't want to say it was horrible because the resource was in the heart was in the right place. What was available just wasn't enough. Like the counselors were constantly on the computer doing more paperwork than they were counseling for the people that were in there detoxing. The people detoxing didn't have, well, you know, I'm military, so I'm rigid with my times. Like all your time needs to be accounted for. Like if you're gonna sit there for a half hour, like that's on your schedule. Like to me, all your minutes count for what you're doing. But this particular place, you have to wait until a bed opens up somewhere else to be inpatient. And then you have to qualify to be inpatient. And then sometimes the inpatient is only 30 days. And what if you can't afford it? Like there is a veterans treatment facility here in our area in Sanborn. It's an all-male facility. What if they don't have the means to pay for it? They have to be on Medicaid. I'm not sure if the VA pays for it unless you're service connected for a drug and alcohol type of situation. But that could be a 3-month program. But again, it's up to the individual to stick it out and want to get help. And it's not always easy to unravel all your monsters and pull all your skeletons out of the closet, because a lot of people, you got to break yourself all the way down to build yourself all the way back up, and a lot of people aren't in that state or in that situation or in that point in their life where they can do that, because maybe they don't have a support system, maybe they got too much else going on in their life. So I think we can do a better job and where we allocate the money. We need more mental health providers, more psychiatrists, more counselors. A lot of people are suffering not just from one thing, it's co-occurring disorders like drug and alcohol abuse, drug and alcohol and PTSD. And I did work in a drug and alcohol treatment court for just veterans in Niagara County, and that was amazing. That judge, and there's one in Buffalo as well, but the judges are amazing. A lot of people are resistant. I want to say half the people are resistant most of the time. But as soon as they get on board and get on schedule and get on track and see that they do have a support system, most of the time it turns their life around, and I've seen it, and it's amazing. So yeah,
Anita, that was something that I wanted to ask you too, because I was thinking about this maybe about a week or so ago. When people exit the military, do you think it would be helpful if they not only got that particular now veteran some assistance, but if they provided it to the family? By that I mean this: when you go into the military, you're a healthy 18-year-old, you're whatever. When you come back, depending on where you've been and what you've seen, especially if you've seen some action, you are coming back with PTSD 9 times out of 10. And they just integrate you back into your family, and your family has no clue what
They're
to
not
do.
supposed to do that.
You can't tell them what they debrief you, but that's not what I'm saying. What I'm saying is long term. If this is my husband, he's gone over to Iran, Iraq, or whoever, he's been shot at, and a whole bunch of other things have happened, and then you debrief him. and you send him back out into society, I have no idea what he's been through over there because he will not speak to me about it, because for various reasons. So I feel like if you get the family that they're returning to some type of something, that it may not be so hard for the veteran that's returning home. So
It's
I'm
gonna
asking,
be
I guess I'm asking.
Yeah, it's gonna be hard regardless for the veteran because like even when I came back, a lot of times I'm like, at this, it's so much easier to be back in Iraq. And some days I'm like, I'd rather be back in Iraq than deal with everyday civilian life. But as far as the family goes, they have a family readiness group while they're deployed. So they do have certain classes and certain resources available for the families as far as when they get back. Yeah, they need to do a better job with the families themselves and the soldier by themselves and then integrate because it's so hard. It's so hard coming back from deployment. It's like, I don't know.
Yeah, like our
It's
VA is
difficult.
one of our VAs, depending on where you where I'm from, there was not a VA that was close by. It was 45 minutes, an hour and a half away, depending on where you're located. So if I'm in dire need, let's say I'm a veteran, I have no transportation. I could very possibly be living on the street. How do you expect me to get way out there to get the help that I need? Because when the police show up, they're not there um, to be concerned about your mental health. They're there to take you to jail, which is the last place you need to be because you need mental health. So that's one of the things that I was really thinking about. I remember when my brother returned home, like he was different. You know what I'm saying? And
Hmm.
it was really baffling to my mom about what to do. And I'm like, you just got to let them work through it. Because there's at some point, there's not anything that you can do to help other than let them work
Nothing.
through it and know that you're there. Huh?
Yeah, that's why I said there's nothing you can do to, there's nothing. We just got to work through it ourselves. And it sounds weird that, I got used to being shot at every day of my life, 24 hours a day and getting blown up and stuff. And I was used to it. And I come back to my own city and nobody told me they do fireworks down at the falls
I
during the
hate,
week.
I
So when they
hate
started
them.
firing off, I was looking at my family like, what the hell is going on?
Yeah,
Like, are we
I
getting,
can't stand them.
uh,
I hate them. And
All right.
I'm closer than you are. And I remember the first year I got here when they started going off. I thought somebody was trying to kick in my back door, and it wasn't until about 2 or 3 minutes later that I realized what was going off. And the mayor, the mayor Dicer, then wrote to the mayor of Niagara Falls, Ontario. And I know people that I'm not trying to make this a local issue, but to what Anita's saying, that type of stuff is jarring to me. I can't imagine what it's like to somebody who's actually seen combat.
it's
Do,
not
do y'all do y'all do y'all
anything
really
that's
think?
comfortable.
Do y'all think when they do those fireworks that their sole purpose is focusing on the military when it's only a small percentage of people go to the military? They're doing that for the overall landscape of people who enjoy fireworks. They don't say, oh, there's people in the military, this might affect them.
Yeah, we
They don't think
understand
about that.
that.
No,
But
it's
there's
not so.
also people that aren't in the military or aren't veterans that are affected by it for other
Right.
various reasons.
Right. It's not so much that,
There
David.
are
It's
people that's
it's
walking
just the
around
fact
in
that
everyday
it's
life.
it's so jarring that the noise lasts for about 20 minutes and it disrupts people's lives. Stop. It disrupts people's lives to the point where they're complaining about it. And it's not just military people. Like I said, it's people like myself who just want it to stop because it's
Hmm.
so disruptive.
They don't care about
Yeah,
that.
No,
Because
they
they
it sounds
don't.
like
don't.
it
That's
go
I
why
it
they
live
go
don't.
all the way
on and
over
on.
by
Right.
I live all the way over by Niagara University and I could still hear it and it really does sound like I'm back in Iraq when there's bombs and then I'm literally waiting for the
To confess.
helicopters
Yeah.
to react and my dogs are barking so that
Yep.
doesn't help me
Yep.
and my house is shaking and I'm like it's very nerve-wracking and then I have to live through it all over again the next time. So we can do a better job of mental health. We really need more money in treatment facilities, long-term treatment facilities, longer than 30 days, longer than 3 months, maybe 6 months. But a lot of people can't afford it. They can't afford to be away from their family that long. Who's going to watch their children? Who's going to take care of their household, their pets, and all this? It's a big mess.
Well, Rebecca
Well,
said something that was true. If you're a person with mental health issues, what is this thing you have with qualifying? I feel like they should allot money regardless.
Mm-hmm.
If I'm being responsible enough as a person with a mental health issue to walk into a place and say, I need help. And then they go, well, how much money do you make? And all this other stuff. To me, those
Yeah.
two things don't make sense.
It,
They've been
And that's why
slashing.
a lot of people
They've
end up
been
in the emergency room. And
Yeah, they've
well,
been slashing the budget for
it's
mental
just
health.
like being poor and having medical issues.
Yeah.
It's absolutely no different. They have a hospital here in Dallas, and the only people that go there are the Cowboys and the Rangers and all those high profile people. And all the staff does is you're licking booty in there if they ask you to do it. They get the best of the best. They get catered to because money talks, bullshit walks. Everybody knows that. And so all the county hospitals, they always have the best staff, but you never get good care because all the poor people go there. And so they're always overcrowded. The
mm-hmm.
ERs look like hotels, and people don't want to go because they don't want to. Nobody wants to sit in anybody's ER for 3 hours. You're going to do that no matter what. But people don't want to go. So it's not so much they ask you if you have money. They can tell by your insurance whether or not
Right.
you can afford the treatment. You know what I mean?
Mm-hmm.
So all the poor people go to these little mom and pop acute facilities, although the rich people get to go to California and go to the Betty Ford Center or wherever she's at, and you sitting out looking at rocks and doing yoga all day, you riding horses, and somebody's telling you not to drink, and you're getting the best meds, you're counseling, they got the beautiful lights and the rainbows and the stars and the unicorns and shit, and you come out of there feeling just great, and hopefully you'll succeed, while the rest of us, you're in a room and the person next to you has bipolar disorder, and you're just in there because you're trying to stop smoking weed, and you too afraid to sleep because you don't know what the problem is with the person next to you, and we can't disclose that. And they get you all nice and clean, and then they shuffle you on out the door and say, you can come back next week for therapy. And people with money and good insurance that has that coverage, they get to go lay up somewhere for 90 days and get their feet rubbed while somebody tells them it's going to be okay. And it's
Mm-hmm.
not. A rich person's mental illness is exactly the same as a downtrodden person's mental illness. How they're treated is obvious, because look at our military, who should be getting the best of the best treatment because they serve their
Yeah.
country, and they don't. So if they don't
Nope.
give a damn
Sure
about
don't.
them, the rest of us,
Don't have a shot.
it's a crapshoot. So
Mm-hmm.
I got
the money needs to be put in place.
probably T.
Yeah.
Got to bring you in. You've been sitting here for a while. What's your take?
You're on mute.
You're muted.
I said I basically agree with everyone else. When it comes to mental health in this country, it's the last thing on anybody's list. Nobody really gives a second thought to it unless somebody goes out there and commits some kind of mass atrocity, which involves either a lot of people getting hurt or killed, and then it becomes a topic of discussion right up there with gun laws. But other than that, nobody talks about it. And it's easy for people to say, oh, there's lots of places out there where you can go and get help, but that's really not the case for some people. Like, I have a friend, I have an associate, a friend, and she has a good job, and she struggled with mental health since she was in her teens. She struggled with it for a really long time. And she kind of came from a family where being mentally ill wasn't necessarily a good thing. You know, it was stigmatized. So for the longest time, she told herself that she learned to mask it, and she would tell herself every morning, I'm okay. And as long as she told herself she was okay until she wasn't okay. You know, and here she is. She's older, and it's like she has kids. She's gone through all the motions of life, and she's managed to manage it till she couldn't manage it anymore.
Hmm.
And then when she got to that point where she couldn't manage it anymore, she checked herself in. And when she sat down and told me about her experience when she physically walked in there to check herself in, first of all, her husband dropped her off, and he wasn't supportive of the whole idea at all. Like, he wasn't supportive. He didn't respect the fact that she was doing what she felt she needed to do for her family so that she could be a better mother, wife, all those things. So she got him in her ear telling her that she shouldn't do it. She goes in anyway because she's like, you know, this is an issue that I've been dealing with my whole life. And I've done little, you know, like she did little things here and there, but nobody really followed. Nobody, and that's the whole point. Nobody really follows up. It's like putting a band aid on cancer. It really doesn't do anything. So she turns herself in. And of course, the minute she tells them why she's there, all the nurses start looking at each other. The security starts looking at each other because she looks, for all intents and purposes, she doesn't look like the typical person you would see being dragged in there. She ain't kicking, she ain't screaming, she ain't trying to bite nobody, she ain't trying to fight nobody, she's not seeing shit. She just walked in and said, I'm having thoughts of hurting myself. I want to get help.
And that's hard to do. That's hard to
It
admit.
really is. And I commend her for it because that was a brave thing, you know, to admit that these are the thoughts going on in your head. There are a lot of people that I don't know that would be brave enough to do something like that. And she was able to walk in there and say that. So then, you know, she tells me about how she goes through the process. You know, they put her in a room, they put a security guard in front of the door, and he pretty much just alienated her. Like, he didn't talk to her, he didn't look at her unless one of the nurses came in the room. Then he might say, "Oh, I have to stand here while you do this, that, or the third, or whatever." But other than that, when the nurses would walk out, he wouldn't talk to her no more. He would just kind of sit there and stare at the floor. And then, you know, the nurses were very clinical about it, you know, not really
Yeah.
speaking or anything. So finally, you know, one of the psychiatrists or whoever was acting as, like, you know, the mental health professional walks in there, asks her a series of bunch of questions, you know, a series of questions. How long have you had this issue? You know, have you gotten any help for it? And none of which made her feel any better about the situation. Because at that point, she's like, damn, can I just go home then? Fuck this, because I'm not feeling, I'm not feeling welcomed. I'm not feeling helped at the moment. I'm kind of feeling some kind of way. So they, 3 hospitals later, because she got transported to like 2 other hospitals after that one, and she sat there for about a good 2 hours before transport even came. And luckily for her, before she left the first hospital, there was a change in shift, and the next security guard came in, and he sat with her and he talked to her and he made her feel at ease and made her feel comfortable. And that made her, she started to feel like a normal person, sort of, to speak. So, you know, kind of like somebody is going to treat me like I'm a person. She got to the next hospital, they stick her in another room, and they forget that she was even there. Like, they forgot that she was even sitting in the room. She fell asleep and everything, woke up, and the nurse is like, you know, I forgot you were here. Like, totally forgot. And then they finally call for transport. You know, they finally call around to see if they can find a bed to put her in a hospital somewhere. So she sat there for about 4 hours. Sat there for about a good 4 hours. Then they finally find a hospital where she can go, which is all the way out in the West Bubble area, all the way off the grid somewhere. So she's sitting there and she's waiting, and, you know, she's cold. She asks for a blanket. Oh, I'm gonna get you a blanket. Nothing. And then she didn't take it personal. She's like, I guess they figured I was gonna hang myself with it, so of course I can't have no blanket, can't have no shoes, no nothing. She's like, damn, they could at least gave me a pair of socks. I was sitting there freezing. But she was like, and she's laughing about it after the fact, but she was like, I wasn't laughing about it in that moment. I felt humiliated. I felt like I was less than a person because they weren't even treating me like I was a person or like I had feelings. So
It seemed to
transport
me,
finally comes to get her and take her to the hospital where she's gonna stay at. And when she told me this, I was like, I would have called and reported their asses. She goes to get in the the car that came to pick her up, and they put her in the car, and a song came on the radio, and she started to hum. And the man driving the car pulls out his phone and said, "Oh, we about to get a concert like the other guy?" And she stopped and she just looked at him. Now, at this point, she hadn't spoken to anybody since she left the first hospital, other than when somebody asked her a question. A song came on and she just started to hum it to calm herself because that was one of the things. That's one of the things she does when she's upset. She hums to kind of calm her nerves. Everybody has a thing. So she's sitting up there, and this guy pulls out this phone, and he was getting ready to record her. Cause I don't know what in this moment made him think that that was okay, appropriate, or any of those things. She is in the middle of a mental breakdown, and you want to record her because you think this shit is funny, or because you think that she's about to say or do something that's going to amuse you. And she said in that moment, she sat back there and she just completely caved in on herself because it's like up until that point, she had people just silently treat her like she wasn't shit, and now she has an active person who's just like, "Oh, you a whole nut job? Let's see what kind of nut are you? Are you gonna entertain me tonight?" Like her situation was supposed to be entertaining for her. And then when she got to the hospital or whatever, and the nurse asked her about her ride, she mentioned it, and the nurse just kind of brushed it off like it wasn't a big fucking deal. Like, fuck her for for feeling some kind of way about it. But
That's part of the problem. That's part of the problem. Because a person has mental health issues do not mean that they don't need to be respected and that they don't have a voice. People treat them as if they don't have a voice. She said this is what happens, and even if she had reported it, I don't believe they would have
I
taken
don't
her
think anything would have
seriously
happened either.
because they have these issues. And this is part of the reason why people with mental health issues need real advocates. Not just real advocates, but they need respected advocates, because you can I was somebody had did a crime and they were talking about it on the news, and the parents of this kid said, we have been trying to get him help for years. We begged the courts to do this and to do that. And because the courts think they know this person better than we do, and they've spent all of 15 minutes in their presence, they discount what we tell them. We've been saying for years he's capable of harming someone, but they don't take those people's opinions and thoughts and experiences and interactions into account until it's a mass situation, a bad or acute or critical situation. And now they can listen. Now that he or she has committed all these crimes or done all these things or lived so far out of what is considered social norms, now we have to pay attention to it. For 10 years, I've been trying to get your help. So even if she had a said something, because she was brave enough to walk in and said, I'm struggling with this, I don't believe that they would have taken her seriously. It would have
Nope.
taken someone else to go in and start swinging, throwing punches on her behalf, and it should not be like that. Mental health should not be a money making thing where you're concerned about making money. You can't even figure out the basics because my answers don't fit your textbook cycles or examples, and
Your
now here
expectations.
I am stuck. Yeah, I hate that when to see that happens, and you can see it happen even in elementary schools. There was a kid that was in school when my kids were in school. And this little boy was so far out the pocket, like, I'm like, listen, something has to be going on. This is not normal for a first, second, third grader to have this much going on. And the teachers who are supposed to catch that thing, two of them were standing in the hallway talking about this little boy as if he was a grown adult man, which infuriated me. So, of course, I had to feel like I had to cuss the teachers out. You know, instead of doing your job, this is your area of expertise, so called. Why are you not trying to see or to help this boy? Why haven't you talked to the social worker? You will sit in this hallway and talk about this kid without even knowing if who this child's relatives are, not knowing who's listening. So if this kid hears you talking about him like this, do you think that's helping him? You know what I'm saying? I just think it's sad that the only way you get some real help is if you have an advocate, and you better have a good one, because God forbid if your advocate can't add 1+1, but that's all you got, then you all the way just messed up, and that's the way your life is going to be.
It seemed to me that we've been, so far what I hear, we've been talking a lot about the aftercare, but not talking about the original issue of what led people to have mental illnesses. We keep focusing on what people who's not doing their job, between counselors, nurses, facilities. But damn, it starts from what is the primary issues, what led
That could
people
be
to get to
anything.
this point.
That could be
Those
anything.
issues need to be talked about instead of the because these are regular people that work, have their jobs, and maybe some of them feel they're underpaid, and it's the same people coming in and out. You grow frustrated with it, and they're just trying to make a living. But what about the initial stage? What is the main issue or the main problem and why these people are suffering from mental illnesses? That's what
I
needs
mean,
to
but
be attacked.
that could be anything. I mean, literally, but you also, I mean, she talked about, PTSD, stress, abuse, any traumatic event can send a person into a tailspin, and I guess, of course, an organic imbalance. And so you have to separate certain things like schizophrenia, psychosis, those types of things, so long as it's not drug induced, as opposed to people being so depressed or having a traumatic event that causes them so much pain that they lash out. To me, those are there, it's all mental, but they're separate. Some things are familial, people are born into it, and other things are caused by a specific event. We could talk all night about
Yeah.
rape victims, child abuse,
Well,
seeing your parents killed in an accident, you know all of those stressors that would cause a person into a downward spiral. But I was listening to Frolic P speak, and she was saying how people reacted to this lady. It's no different than how we all react to anything that we've been desensitized to. It's like seeing bad kids in school. That really should not be normal, but you see it every damn day. Kids
Right.
coming to school dirty. That ain't normal, but we see it every day, to the point when you're going home and you're sitting at the dinner table, you're telling your spouse about it, and you're laughing. Not that it's necessarily funny, but you're laughing about it. Nurses and doctors and healthcare professionals are the exact same way. We see so much shit every day over and over again that it's just, sometimes it's just so damn unbelievable that it's funny. People who work in the service industry, you're supposed to be, kind, and he said people are just becoming increasingly rude, to the point where, it's just normal, and your reaction may have been shocked and appalled in the beginning, and now it's just like, fuck you back. We have become so used to seeing abnormal things that they have become normal to us. So seeing somebody going through their very first experience of suicidal ideation, I done seen this shit 100 times. You know what I mean? Not that it's right, but we've become so used to seeing people wandering around the street begging for money, women beating their kids, men shooting up their whole damn families. They done killed a whole damn school full of kindergartners, and don't nobody even talk about that no more. It is so common to hurt people and to harm people and to seeing people in distress, hungry, homeless, mental illness, that it's, we roll past people begging for money because we make the assumption that they just want to drink, that they're not really hungry, or they're not really homeless. We are so used to seeing abnormal things that it's normal to us. So
So
you
why is
know,
it? So why is it the service providers issue, and we're not looking at the family issue? Because it seemed like even for our schools, everything gets blamed on teachers and everything else. Everything.
'Cause they
Your
are the
kid can't read.
professionals.
Your kid can't read, but it's the
until
teacher's
now,
fault. It's your
they ain't
teacher.
doing that shit no more though, are
It's the
they?
teacher's
Because now
fault.
they're at home with them.
Yeah.
Now
Yeah.
the
Well,
parents
because
are
It's,
You
seeing
know
it
what?
bad
It's
as
God
kids
they
at
damn.
they're
home.
the
So now they loving teachers now. They loving the hell,
you know what? It's
at least
funny.
in Texas. They loving the hell out
that-
of them in Texas now, because now all these parents are stuck at home with their little raggedy ass kids that don't want to act right, and wishing, hoping, you know, for them to be somebody else's problem, because I'm not a teacher. I'm a nurse. And a lot of parents thought like that. They think the solution when they go home, we just do the family thing. Y'all are supposed to be teaching them that. And now that they're my problem, I realize that I haven't followed up on what you did all day in school.
Right.
Just like patients don't follow up when they get discharged, all my hard work in the hospital, ain't
Wasted.
nobody following up on that. No support when they get home. You can move this from profession to profession, but as a society, we don't care for one another. We just simply don't, in any realm, no matter where you put it. Teachers were getting shit on for the first, what, 8-9 months of COVID. My daughter was getting all types of raggedy emails talking about, you know, I don't care, my kid is there to learn. And she's just looking at parents talking about, but it's up to you to push the button so they could get on the computer. They're 4 years old. You know,
Right.
parents took themselves out of that because they didn't consider that to be their job. And now they're realizing just how important it is to have family involvement when it comes to schooling. And it's the same way
Yeah.
in mental health or any profession
Yeah,
that you
so the
move
whole
in.
point, what I was saying is, with everything, family and close ones remove themselves from everything and put it on everybody else. And
Well,
That's
let me
again,
say this.
the blame
Dave,
game.
a lot
what
of
can
the
I could,
time,
Dave,
a
could I
lot of the
say
time.
anything?
Oh, I'm sorry. Go ahead. I apologize.
I
Go
mean,
ahead.
and that's the thing. So we keep looking for other people to have that silver bullet, but then you have to look at yourself. Are you giving your all? Are you doing the best that you can do to help this person out? And many times people like, no, just send them here. Though they got treatment here, they got treatment there. But those people, they're getting a paycheck. They're getting their paycheck. They're looking at their clock and saying, damn, 3 more hours of this and I'm out of here, or whatever the case is, so I could go back to my family. So it's like I keep saying, a lot of this stuff is family issues. It's a family thing that we don't have a hold of, and people keep stepping out into the community with these issues. You can't wait for somebody in the community to solve anything. If you want
Yeah.
your kids to get good grades, shit, you're gonna have to do it's repetition. It's repetition outside of school, over and over and over, drilling that stuff in their head to make them a better person. That teacher got 200, 300 kids. They have their favorites, and then they're gonna keep it moving. The ones that really ain't showing no effort or whatever the case is, after a while, it's gonna like, listen, I ain't got time for that. I'm gonna work with kids that want to learn and want to do something. Same thing in hospitals, and when you have patients that don't want to comply and all that stuff, sooner or later you're like, man, I'm not about to deal with this one, but I'm gonna help this one out. This is where we at. This is where we at.
But it's the same with mental
That's
illness. Who's to say that family members aren't out there advocating for their loved one and trying to perform an intervention to get people into treatment, and they absolutely refuse. You know, again, as an adult, children don't count in these scenarios because the parent speaks for them. But as an adult, you literally have to have somebody arrested to get them into treatment so that they can get to court, so that the court can say, yes, you have to go there. Here in Texas, the police can pick you up and they will drop you off right at our front door and be like, there you go. But again, these things don't work. Just like your children in school, if you got a kid that don't want to learn, there ain't a damn thing you can do about it. Not nothing. There ain't a damn, no matter all the begging, pleading, wishing, hoping in the world. If somebody doesn't want to do anything, you can put them in that environment. But if they're not receptive to the learning, the teaching, the treatment, the medications, it doesn't work.
Yeah.
And
Sure.
as a human out here in the world, I have my own life to live just like everybody does. And most of us think this way. I have my own problems. Every day I have my own problems, and I'm trying to make it through my day. It doesn't make it right, but that's what it is. And nobody has time for someone, like you said, that does not want to comply. They just don't. People don't have time for that. And the mentally ill is a double-edged sword. They need the help, they need the intervention, they need the force, but at the end of the day, if they're not a willing participant, there isn't anything you can do. So if my family member needs help and they just won't take it, no matter how much I love that person, after a while you get tired of that shit, just like you do anything else. Not that I want any harm to come to my family, but at some point you're not fixing to kill me because you want to kill yourself. I don't want you to die, but you're not fixing to kill me neither. And at some point people wash their hands, of this, and it doesn't make it right, and they set them out into the world on the rest of us.
Yeah.
All right.
No.
All right.
I want to, if I'm allowed to say, why a lot of people look to the teachers and things like that. For one, they're the professional. They are trained in ways that parents may not be, to identify things that are not going as they should be. And I'll give you an example. This young man I know, his mother was very frustrated about what was going on with him in school. He would get bad grades and act out and, all types of things. But I saw this young man, he could sell ice to an Eskimo. He could sell snow to a doggone snowman. So that tells me that you have a level of intellect that means that you are able to do this, because you got to be able to read people. You got to be able to do certain other things to be a good salesman. Well, and I told her, I said, you need to take him for testing. There is a break, because schools are only set for you to learn through reading and writing for the most part, unless you have a special ed class. Long story short, turns out that he could not learn from reading and writing. He had to have it audio. So they just have the book recorded and speed it up. Instantly, almost overnight, he became an honor student. On the next report card, he had A's, because his ability to learn by the set standard was not there. And like my little one of my relatives, actually, very engaged, very involved student, did his best. It took until the 7th grade when his grandmother, which was my aunt, pulled him out of the school he was in and put him into a better class of school, something like one of those ones, like I'll say Huntington or something. I forget the name of it. But only to find out there was an issue with his eyes. He could see the top of the paper and the bottom, and he thought he had the whole entire story, but everything in the middle was missed. So there were some things that they had to do for him to help remedy that. So when you have someone who's having these types of issues, they're acting out in class, we trust the professionals. If all you're telling me is that my kid has oppositional defiant disorder, parents don't know. Parents
Teachers
don't
don't
know.
either, though. They're not trained for
Correct.
that. They're
Hold on, let's
trained to
Scorpio.
teach.
Let's
Well, they're
Scorpio T
trained
get
to
in.
learn.
Hold
They're
on. Let's
trained.
Scorpio T. Let Scorpio T get in.
Frolic
She's
T.
been having her hand up for about the last 5 minutes.
I am Scorpio T.
I'm sorry, Brolic T.
Frolic.
My apologies.
So all I was gonna say is I need people to understand is that when it comes to teachers, there's a difference among teachers. And David, you can speak to that. Like there is
There
your
you
general education teacher who their specialty is just your 4 common subjects.
Yep.
Reading, math,
Right.
science, social studies.
Mhm.
If you're expecting them to diagnose your child, that's
gonna
not going to happen.
correct.
Thank
A
you.
really good, any good special education teacher
We'll be able to
worth
diagnose.
her salt can look at a child and say this child needs something more. But then it falls on the gen ed teacher to sit down and write that paperwork that says, hey, I'm experiencing this issue, that issue, and this issue with this child. What can be done?
Correct.
Once that's done, they sit down, they have a meeting. Let's set it up for the next 6 weeks. Try this and see if that helps. And it goes through
Absolutely.
a process.
Now,
But
both of these
most
young men
teachers,
that I spoke of,
a lot of teachers are not going to sit down and fill out that paperwork because they'll start off by, hey, calling the parent and saying, I'm experiencing this problem or that problem with your child. And the parent would be like, well, shit, I sent them to school to you. That's your problem. And hang up the damn phone.
That's the issue.
And that's where the
That's the
problem
issue.
lies.
That's
That's
the
where the
issue.
What do
problem
you
lies
do
with the
with
parent.
that?
That's what I was
Because
saying from the
that is
beginning.
really where the problem lies. It's not with the teacher, it's
Yeah.
with the parent.
The
Because
parent.
if the teacher calls you and says, hey, I'm experiencing this problem or that problem with your child, I need to sit down and have a talk with you about it. Let's get on the same page. Maybe, because some general education teachers do have a specialization. They just don't work as sped teachers. They work in a regular classroom. I've done that before.
Mhm.
And if I call you and I say, I'm noticing this with your child, I want to sit down and have a meeting with you. And you like, hell, I send them to school 8 hours a day. That's your fucking problem and hang up in my face. Then I'm forced to think outside the box and remedy the situation on my own. Because you don't
now
always
when I
have
was
that partnership outside. And it's easy for somebody to say, oh, it's the teacher's fault and they're with them all day. You send your child to school. I can't force your child to pick up that pencil and take their notes. I can't force your child to sit still and listen to me. I can't force your child. Even I could create the most interactive lesson that hits on all targets. It's audio, it's visual, it's tactile, it's kinesthetic, everything that a child could need to learn. But if your child decides that they want to sit there and face the damn wall the entire activity, I can't do anything about that.
Right.
That's
and I
when
agree
it
wholeheartedly
needs to
with
be
that.
a partnership. Like when I call you and say to you, well, when a teacher calls and say, I'm having this problem or that problem with little Sarah or Shaquan, whatever, we need to talk about it. Then a parent needs to be open to it. And I understand. I'm a parent. Sometimes you're busy, but your child is supposed to come first, regardless to anything you may have going on in your life. Because let me tell you something. Where I come from in New Jersey, let your kid cut up in school. You either can deal with them voluntarily or involuntarily, and the court drag your ass in, and now you got to answer questions with the people about why your kid cutting up in school and what have you done about it. And please believe, by the time it has gotten to that point, the school has their stack of paperwork to say, on this date, I called the parent and this is what the response I got. On that date, the child did this, I called the parent and that happened. On this date, we were supposed to have a meeting and the parent didn't show up. Please believe that while you're neglecting your child, they're building a case on you and that kid.
And to follow up what
I
she's saying,
meant by that was I was strictly speaking in terms of the diagnostic portion. Like parents are okay. So when I ran the daycare, we had a set of siblings. Okay, a set of siblings. These 2 out of them. These were girls, by the way. These girls were maybe 4, no, they had to be at least 5 because they were in school or preschool anyway. So when they got to the daycare and they started doing some real off the wall stuff, the parents come to pick them up. I'm like, listen, we have to have a conversation right quick. And I'm telling them this, that, and the other. And in speaking to them more in depth, I realized that the parents had no clue that something was wrong. Like,
Some
this is
parents
not
don't.
normal behavior. And because to them it was normal, it wasn't a problem. It wasn't until they got into a different setting where you learn that there's a problem. So in terms of what I was speaking of, even those two young men were in special ed, so the teachers in the special ed class kind of dropped the ball. But I was just saying that this is the reason why people look to teachers, because they feel like they're the professionals. They're trained to identify
Well,
this, and another, so on and so forth. That's the reason. Like, I have a kid that's dyslexic and smart as can be. He's dyslexic though. And it was a teacher who caught that early on when he was learning to say, listen, take these steps, do this, do that. I didn't have any idea.
Mhm.
I'm like, I don't know what's wrong with you. Get me a belt because I feel like you're tripping. So I'm at home trying to correct the problem in a particular manner that's not going to be effective. It was a teacher that told me that. And I say
see,
that this is why parents look to the teachers to tell you things, because you don't know. You just think you got a hard-headed kid that's, doing the most in school, not knowing that there's a real problem. And just for the record, where we were at, dyslexia was not even considered a special education issue. They feel like you should be able to move around in the regular classes, especially undiagnosed, and be able to do well. But once I was able to get that diagnosis, I was able to advocate for him to get him some help. But without that teacher, I would not have known. So this is why parents look to people like the teachers and the
well,
counselors and the social
what, a-
workers, because they think you know what they
what,
don't know. Because
the
I
thing
really
is,
did not
Thing,
know.
though.
what
I
what
didn't
the
know.
thing
Thing,
is,
though.
the thing is, you have to be a parent that's open to listen to someone that you think has expertise in the area, and that's not always the case. It's many times I have parents in my office like, you know everything. All right, so you know everything. You're here all the time, whatever. So you know everything, and I have to get like that. And then after they think about it, like, no, I really don't know, whatever. Well, you need to listen. You need to listen. I'm sitting here telling you what I seen, what teachers are telling me, but you have your answer because your kid texts you because they're running game on you, and you coming in there with your chest poked out, and you don't want to listen to the counselor, you don't want to listen to the administrator, you don't want to listen to the special ed provider, the paraeducator, whoever. So that falls on somebody being open-minded and not just falling for the 52 fake out from their kids. Now let
I
me
don't disagree with that. I do not disagree with that. I saw it play out in Living Color. Teacher, the little girl was so bad, everybody knew the girl name in school. Okay, just the little girl did whatever she wanted and went home and told the mama the teacher was picking on her. So after several months, even with the teacher, the principal, the social worker reaching out, the mom decided, I'm gonna come up to the school, I'm gonna beat this teacher's butt. That
yeah,
lady, that
yeah,
teacher whooped her from one end of the hall to the other. And I was cheering her on. And when she got done whooping her, the police took her away and took her daughter to social services. This is what, now that right there, this kind of stuff starts at home. I definitely agree with that.
But all of
Because
it started at
instead
home.
of you
I,
dealing with your
I think
kids,
all of it
you
started
should
at home,
yeah,
to be honest.
yeah.
If I could, I know I've been kind of sitting back, quiet, listening, but it all starts at home, period. And as much as we want to try to put it on anybody else, we can't. We know our kids. When I think if we're in tune as parents, we know what our kids are capable of doing. We know we let our kids get away with at home. We are very aware of our children. So I think it's a parent issue. Even when it comes to mental health, I think if people stop pointing at the person and start thinking about what's their environment, what has affected them as they've been growing up, like even with your friend had the situation, she couldn't even go to her own family about her situation because they didn't even want to acknowledge that that's from her family, that's from the top, that's from her parents that didn't allow that openness for her to be able to go through what she needed to go through to deal with her issues. It comes from the top. As much as no one wants to admit they're the issue, I can go I could share story after story. Like, so one for with my one situation, I had two boys at the charter school, and they were acting out, and I knew it was because of their dad. I checked myself. I'm like, wait a minute, my kids start acting out. Wait a minute, is this something that they're getting from me? Is this something that they're learning from what they said, they're a product of their environment? People are products of their environment. And if you're not checking yourself first, then you're doing your child a disservice. And that's how I look at it. So after I saw my sons were acting out, we had a parent teacher conference with their teacher, with the counselor, with their dad, and I was there. And their dad had the nerve to come out of his mouth and say, well, I taught them to act like that at home, but not out here. No, it's going to trickle outside your home. It's going to trickle out. It's not just going to stay in the house. So the more we start talking about where the person came from and start dealing with that first, then it's going to keep going on. No, you're not going to find issues. You're not going to, find solutions, because no one's really tackling the real issue. That's how I look at it.
There we have it. That's the conversations that need to be had. That's the shit that need to be discussed over Thanksgiving dinner or whatever the case is. Like, yo, what's good with such and such? What's going on with our brother? What's going on with our sister? This is what they're doing to me. This is what they're saying. This is what they're talking about. How do we attack this? But when only one person is dealing with it in the family and other people have shunned them away, then we have these issues. That's the importance of having these conversations, which we don't have too many often, because people run straight to social media and they get stuff out like that. And we know it. Dealing with mental health is people every day that you go through, you stroll through your timeline, like, I didn't had it enough. This is it for me, or I can't take it no more. And this is how they're putting stuff out there. And then you have people like, what's wrong? Don't do anything. Calm down. It became more of a, and granted, that may be a way, and some of them are serious like that. Some of them are just looking for attention, but it became like a circus, whatever. And some of that stuff need to be dealt with in-house. Granted, sometimes the way we were brought up, we were told to keep everything to ourselves. Don't air your dirty laundry. And at certain times, some things probably should have been told. Yeah, Uncle Willie is a freak, but you were told not to tell anybody, but Uncle Willie kept touching you and all of that stuff. Obviously, that method didn't work. But in another sense, you think about having these conversations. I think our older generation meant well to try to keep everything between the family and don't go put stuff out there. But at certain times, children needed outlets too. And if they were told from the home, you don't tell this, you don't tell that, and you know something wasn't right, it should have been some other personnel that you could talk to. So, and a lot of times it was always this black and white issue, because many educators, counselors, and things like that wasn't necessarily our color. So, and you were taught over the years, like, I can't say this, I can't say that, talk to this person. But now, as I tell students, you can't use that excuse, because you're surrounded. It's more black educators, it's more black counselors, the principal, the administrators are black, and whatever the case is, and vice versa. I don't discriminate with anyone who comes in my office. Pain is pain. They come, hey, let's try to handle and let's solve this, whatever, and let's talk about it. But there's so many other variables that need to be discussed that sometimes we don't do it.
I would like to ask a question that goes along with your statement, Dave, and whoever feels free to answer it. Are all behavioral issues rooted in mental health issues?
No, all of them are not.
Some behaviors are just learned behavior. Patience is a skill. It's a skill that you learn. It has nothing to do with, well, it could possibly have something to do with mental health, but patience is a learned skill. But I believe that every problem doesn't start at home. Everybody's mental illness or abnormal behavior doesn't always start at home. It doesn't necessarily come from their family. Some of these things happen in adult life, i.e., a rape victim, somebody from the military. So I think saying that, you have to take this back and put it all on the family, I don't personally agree with that, because sometimes that's just not what it is. These people and these problems have to be treated individually. I've
Well,
always likened teachers to nurses, always. I've always put them in the same boat with me, because I feel that we do the most, get the least amount of praise, the least amount of pay, the highest expectations, for outcomes. Teachers are not doctors, they're damn teachers. They're teachers. Adding 2 + 2 together has nothing to do with my damn psychosis. Nothing. And in Texas, teachers they can't even diagnose a learning disability. It has to be a trained developmental psychologist, the occupational
well,
therapist, something. You
see,
have to have a license. Not to say that you can't be dual licensed. You can't be a teacher and
the,
a psychologist. But here in Texas, they can't do that. So for a parent to say, which I think is so dead wrong, that kid is your problem, is ridiculous, because listening to the two of them speak, I hear my daughter's voice, in my head. A lot of kids hide shit from their parents very well. I know I did very well, and my mother was all up in my business, and you can do it. Kids are some of the most cunning, and you can come from the most well-adjusted family, two loving parents, your siblings are all that, the grandparents are, they wear aprons and take you fishing and all of that, and you can still come out with some sort of issue. Just finding the root of the problem is what we need to do, not
well,
necessarily assume that it's the family
well,
that caused this problem, or hid the
nobody said
problem,
that.
because everybody's problem doesn't present in their childhood. It could
Well,
present in their adulthood. You're living in California, your parents live back here, in New York, and you got a problem. Why is it my fault? It's
we,
not my fault if I don't know. So I think to blame the
I don't
core
think
family or the teacher or the nurse is wrong, when you should just get to the root
I don't
problem wherever it starts.
I don't think that it was blamed on the family, but I know for myself, no matter what, if something happened to me in my adulthood, typically I'm going to find someone close in the family that I'm going to go to first, someone that I can trust. I'm not going to automatically go to a psychologist or a mental health provider. I'm going to go to someone in my family first. They're going to be the
Well,
first
that's not
ones
what I
so that,
was saying.
well,
That's not what I said, but okay.
okay. And then for the other thing, when we say, as far as different professions and all that stuff, it all starts from teachers. No matter what profession you're in, it start with teachers. Then you have teachers that specialize in certain areas, but it all start from teachers, judges, or whatever the case is, nurses and all that. It all start from basic teaching to give you that love or that passion, and they guide you into a different direction. So yeah, teaching is everything as far as
So
profession and
teachers
careers.
are professions.
Parents are the first teachers, so make no mistake about that.
Parents
I'm
are the
just
first
saying that
teacher.
in terms of mental health, things can work. I mean, it can go either way. A lady told me her kid was diagnosed by a doctor, a mental health doctor, with having ODD, and advised her to pretty much, there's nothing, she was told there was nothing that she could do about it for the most part. How is that possible? So when I sat down and I talked with her and showed her what this meant, she was able to understand a little better that, yeah, you still got to set boundaries, you still got to discipline, you got to do this, you got to do that. You cannot make this an excuse. I don't care what they said, you still have to hold them accountable. But because she was receiving information from a not so good, um, I guess I'm gonna call her a therapist, a not so good
Yourself another
therapist, the kid was just running wild, and that's not the way that works. So it still takes a village in order to get it done. But even after the diagnosis, I'm sure Barlick T, Rebecca, Anita, a bunch of everybody can pretty much say, well, they told me they was diagnosed with this. Now what do I do? What is this? Parents don't take it upon themselves to learn about to learn about whatever the diagnosis is either. They're
The great
lazy in that aspect too. They
the
just say,
great Stephen Covey said you have to diagnose a situation before you can prescribe a solution, whatever. So you definitely have to diagnose before you can prescribe. A lot of times we got the cart before the horse. We're prescribing something without diagnosing the true issue of what's going on. As someone said, the root evil, maybe Rebecca said the root evil, the root cause of the situation. And there's a lot of root causes that people ignore. It's a lot of cause and effect. Everything has a cause and effect to it. And sometimes people, again, sweep those things under the rug and carry on. And
Absolutely. Absolutely.
And that's the one thing I
agree with
say
that. I
that
was just
what
saying
you
it's
were
not
saying.
always the family. That
And that's it. We
sometimes it's
always,
something.
and that's what I wanted to say. So there, as we know, we don't operate in absolutes, but when we're talking about children, for the most part, my opinion is that it does start with when it comes to behavior issues. It comes from the environment and the way things are being done in the environment of the home. So, there's all kind of traumatic things that happen in people's lives, as we already know. It's already been said that different things that happen in people's lives, but it still falls back on how we operate ourselves every day. We still are part of society. We are still a part of society. If we ourselves are not even getting the help that we need or acknowledging the help that we need ourselves by the way that we act every day, that's what I believe he's trying to say from the beginning. Why are we not talking about, like, it's the people that don't say anything, that don't get the help. That's what we're talking, that I keep seeing too in the comments. The people that say they're getting, that needs the help, that's going to get the help, those people, for the most part, I've heard people say, if someone's going to commit suicide, they don't ever say they're going to commit suicide. They're just going to do it. Because even so, with mental health, if somebody's going through something, for the most part, they're not getting that. This the people that's quiet and they're not getting the help they need to get. And that's because nobody thinks they need help. Everybody thinks they're sane. Everybody thinks what they're doing is okay and is good, but it's not, because if you think about your actions, they speak loud. Your actions, just think about if you had road rage, you didn't cuss somebody out for, driving a certain way. What did that car, like I'm in a car with somebody and she's yelling at a car driving next to us. That's the other lane. What is wrong with that person driving in the lane next to you? And she's cussing that person out because the person is riding in a car lane, in a lane that was created for that car to ride. It's like just the different things, different actions we do daily, and we think it's okay, and it's not. And it causes mental disruption trickling down in society. Like, just like maybe you cuss somebody out and then that person was having a good day, but then you cuss them out and then now they going to work and now they cussing the next person out, they mad, and then somebody's starting to shoot somebody because over something that was just so minute. It doesn't always have to be so crazy drastic. It could be just the simplest thing that can tick somebody off and cause a whole crazy reaction. And that's what I think. So that's what I'm with ourselves.
The only thing I was trying to point out is that behavior and mental health do not go hand in hand. That's basically what I was trying to point out.
So behavior has nothing to do with mental health?
They don't always go hand in hand.
I said they don't go hand in hand.
Like
thoughts, feelings, behaviors, and then actions, they all connected. They're all intertwined. Thoughts, feelings, action, and behavior. They all go together.
How many times have you threatened to kill your kid because of something they did?
Well, we know we're not
I'm fixing to kill you. I mean,
That's not literal though. Well,
it's a
some people it
overreach.
is.
I
Yeah.
mean, well, yes, of course, because we should be treating people as individuals, and it's an overreach to say that because, you know, I called you an asshole, now you're going to go to school and shoot up all the damn kids because I made you mad. That's an extreme overreach when you're talking about people and their mental illness.
That's like bullying.
How,
that's where
and
bullying
how, and how they act.
That's not a
it's
stretch.
totally
That's
different
bullying.
thing.
People get bullied and they want to go back and start killing people because they just got bullied. That's not a stretch. People
it is
going
a stretch to say that if because I call you an asshole that you decide to kill your entire family in their sleep.
that could
That's
tick
how
somebody
those things
off.
happen.
Absolutely.
Usually that's something to build up, whatever. But
It's
your
like-
behavior,
right, like-
your behaviors is based on your thoughts and your feelings. Your thoughts and your feelings.
That exactly. That's not always the end all be all for some people. For some people,
And that's all I'm
straw.
saying
I'm
is
just tired of this shit. So now I'm about to go do some damage so people will hear me and understand me. And then some people, that's literally the idea in their head. Oh, I'm gonna make you hear me. I'm gonna make you see me. Like I work with kids every day. And just to build off of what Judy Lynn said, connection is key sometimes, because if a child does not like their teacher, they're not gonna learn from that teacher. I don't care how good that teacher may be. If they don't have a connection with that kid, it's just not happening. Like when I started at the school that I work at last year, my kids hated me. And I told my principal when she hired me, my kids are going to hate me at first, but by the time it's all over, they're going to love me and I ain't going to be able to get rid of them and they won't be able to get rid of me. And that's just how it is. Because I came in telling them, y'all, I have expectations. Y'all going to come in here, y'all going to sit down, y'all going to get this education. And they're like, lady, who are you? The last few teachers we have couldn't make us do nothing. What makes you think that you're going to get me to do something different? But I've always been the type, I let my work speak for me. I show you better than I could tell you. Tell my kids in a minute. Easy A, fast F. Which one you want to do?
But that's exactly why I use the oppositional defiant disorder, because that's a diagnosis they throw out there all the time, which basically means your kid is lacking in they're lacking discipline for their actions. In other words, little Peter come in and knock over everything in the classroom, and because he has oppositional defiant disorder, you're not supposed to do anything either. No, go sit Peter outside in the hallway and let him
Little
think
Peter
about
is going. Little Peter is going to go pick up all that stuff that he
Pick
knocked
that
over, because in the
classroom up,
real
exactly.
world, if you did that, the cops are coming to get you, and you're going to have a bigger issue. So in my classroom, my children with behavior issues, the first thing I teach them, you got to have self-control. You got to have self-control. Just like I got to come in here, and there are days, I tell my kids all the time, there are days in here where I want to come and slap some of my coworkers. But if I slap my coworkers, what do you think is going to happen? They'd be like, you're not going to have a job. Exactly. So when you come in here and you do something that you know is a violation of the rule, you can't sit up here in my face and cry about the consequence that's coming to you, because it's coming.
Exactly.
So what you need to do in that moment when you feeling frustrated, take a deep breath. Some of my students will run up to me, and I'll be like, stop. Because first of all, when people yell, I stop listening. That's just the automatic. When you yell, I stop listening. So stop, take a deep breath. Now run it back to me in a calm tone. If it's something I can help you with, by all means, I'm on your team. But if you're in the wrong, I'm about to tell you about yourself.
Right.
You're in the wrong.
That's exactly why I
And
said
those
what I
sound like
said.
behavioral things. Though that sounds like a behavioral problem, not a mental problem. And mental health is
Behavior
strictly
comes
psych.
from thoughts, feelings. Then there's behavior,
Yes,
thoughts,
it
and
does,
feelings.
but
Yeah.
it doesn't mean that you have a
Thoughts
psych
and feelings.
issue. It means that you have a behavior problem.
I have
And
taught
mental
kids
health
who-
is strictly
I have taught
devoted
kids.
to your psychological state, and behavioral health has to do with behaviors that
Behaviors come from thoughts
you
and
think.
feelings. That's the bottom
I
line.
have-
You're
Doesn't
mental. You're
necessarily-
mental.
I had a
Thoughts is
kid-
mental.
I had a kid
Okay.
who had a mental issue.
Just because you have a
One
mental
day-
struggle doesn't mean that you have a psych problem.
No,
I
I
didn't
mean, I
say
had
all
a
that.
kid.
No one's saying you have a psych
Listen,
problem. We're still saying
I'm
listen,
telling him.
I taught
You
a
ain't got
kid
to
who
tell
had
me
a
that.
certi-
I've
he
been
had
through
a-
that, Brown.
I had a child that had a certified he was certified with a mental issue. Some days he would come in and be himself. Some days he would come in and be a whole different person. And I had to deal with that other person. I'd be like, okay, you could be that other person today and be yourself tomorrow. But I had to meet him where he was at and deal with him accordingly. I still dealt with him like a person, even though he came in and today he Johnny Blaze. I'm calling him by his name. No, I'm Johnny Blaze today. Okay, Johnny Blaze, here's what I need you to do. I need you to pick up that pencil. I need you to bring your notebook and come sit here at the table so we can talk about some things. And that's just the end of it. Like, he'd have his days where he'd come in and he a whole different person, and I just have to roll with it.
Herb,
Yeah,
You know,
I
you
had
ain't been in a
one
while.
I had a little boy that had
No,
Down.
I'm listening because there's some invaluable input, and I know, the area of the limit of my expertise, and what I will say is to what Scorpio T was saying. I encountered the kids that were in a same-sex house, and one of the things that they were doing was they were acting out. We understood that the gentleman and myself who were aiding them, if you will, we understood the dynamic that they were facing, and what we were trying to tell the two ladies was this: you guys had them in a situation to which they're uncomfortable with, and so it's just like you were saying, their thoughts and feelings were manifesting itself in this behavior. They didn't have a mental issue; they had a behavioral issue, but
Thank
because
you.
it
Thank
wasn't
you.
as such, they were acting out. People were saying, well, they need mental attention. No, they needed to be out of that environment because that environment wasn't conducive to them. So I think these type of conversations and topics need to be understood, but they also need to be nuanced so they're not misdiagnosed as something that they're not.
At the end
And
of
I
the
agree
day,
with that.
at the end of the day, whatever drives your behavior, you're thinking something. Oh, I'm going to behave like this, or today I'm going to do this, whatever. If I don't get my way in class, if the teacher don't say this, whatever, I'm going to act this way, just as well as children do with their parents. Oh, if they say they're going to take my phone, then I'm going to do this. They're thinking something. If there's something mental driving those behaviors. There's
But
something.
that doesn't
It's
mean
just
you
not
have a
like their
mental
minds.
issue.
I never said that there had to be a mental problem. I'm just thinking about the whole landscape of how people, your behaviors, how you behave, how you operate in your behaviors. It's thoughts and feelings, whatever. Also, I want to go back to that point with Judy said about the connection is content. Yeah, that's important too. And I could tell a quick story of when I was in the elementary, and these were special ed students. I might have mentioned this before, and like you said, Brolic T, that they said, man, we ran everybody up out of here. We ran everybody up in here, and I came in there, and they was like, Mr. Glover, could you cover this class? And I went in there, and they was like, oh, Mr. Glover in here. Let's see if we can make Mr. Glover cry. What? What? And when I gave them my connection to all of them, it was about 8 or 9 of them in there. And I went through their names. I said, oh, I know your mother. I know your uncle. I knew such and such. And I went through every one of them. They're like, dude, you know all that? How you know all of them? Some of them I went to school with. Some of them I probably even hung out with. After that, they were on their best behaviors because they knew this man was connected to me. He knows my uncle, aunt, my mother. He knows their nicknames and everything. He know where I grew up at, and it was that connection. And their behaviors stopped because mentally they were thinking something else. Oh, we're going to try to make this man cry. We're going to try to make this man cry. But when I broke them down and told them, then they was like, oh, man. Oh, all right, Mr. Glover, we're going to chill. We're going to chill. We're going to chill. Because they knew.
You know, sometimes you can really tell the kids whose parents don't play certain things at home. And I think Brolic T can attest to that. When you say, I'm going to call your mother or your father, and
all that tough talk go right out the window.
Exactly. Everything goes out the window. The one young man I had, he was 13. And when you're 13 with a mental health diagnosis, well, he really just only had Down syndrome. I don't even know why. Anyway, He was a highly intelligent young man, highly intelligent. But because he had Down syndrome, he was used to doing what he wanted to do. So when he came to me, I'm not finna play this game with you. You're gonna do like everybody else in here. You're gonna sit down, be quiet, follow suit, and do as you are told. Now, the strange thing is that we had an occurrence in which I ended up having to talk to his mother during this parent conference that I was having. He was doing everything. The mother's like, "Oh no, stop, stop, stop." So I called him over. I said, "Come here. You're in my location. Get yourself over there and sit down until I tell you to get up." So when she saw that he went and sat down and was not going to move a muscle until I said, "Come here," or move, or released you from wherever it was, she was like, "How did you do that?" I said, "Because I don't play that game. You cannot." He was so smart, so smart. He was highly intelligent. And so to just assume because he had Down syndrome, that means that he had some other thing going on was incorrect. So that was the only thing that I was the point I was trying to make is not all behavior is rooted in a mental health issue, not
Thank
all
you.
the times. And this is why you really have to be able to separate the two and have enough training and knowledge and people
Thank
around
you.
to assist you in separating it. That's why I asked that question. Mental health is very real. And for those who have it, they need very real treatment, very real assistance, and very real support. For those who
Well,
are out behaving or acting out, they need a different set of
let me
things
ask you
to be
this.
met. So
Let me
that's
ask you
all I
this.
was saying.
We know that it's not all rooted into mental health. Well, what makes somebody mentally ill? What makes somebody mentally ill?
Usually it's some sort of organic
It can be a couple different things.
But is it
shit.
something that's driven from their behavior, and you classify them as, oh, they're mentally ill?
Based
No,
on something that they did.
usually mental
Yeah.
illness like schizophrenia, psychosis, although psychosis can be induced by certain drugs. But
And how do you
usually things
determine
like,
that, right? How do you determine
yes,
that?
they can
took drugs,
determine that.
they took their drugs, whatever, but you make them mentally ill. It's something they did, right? That leads you to that
Not
standpoint.
necessarily. There are certain drugs that people can overdose on and not die, and it can elicit a psychotic episode.
An episode,
And
meaning what happens during that episode?
they're psychotic.
Like doing what? Like
Literally
what?
psychotic. And once that medication has run through their system, they usually come back to being normal.
Yeah. What
Okay,
Rebecca's saying
But
is
the reason she can't give a blanket answer to that is because
no.
everybody's psychosis
Rebecca's not giving a blanket
and
answer.
behavior is different.
Hold on, brother, Scorpio. I'm sorry, Bob T. What Rebecca is talking about, once they have been diagnosed, they have a plan mapped out for them. So
Right.
she's speaking according to that particular medical plan that patient has, that they know what their norms are. So when
Right.
they administer that
And
medication,
there is a diagnosis
I didn't
for
work those psych floors
drug-induced
for years. So.
psychoses. People with schizophrenia and stuff like that usually is some type of organic imbalance, but nobody truly knows where these things
But it's a
come from.
behavior that led them to probably being
No,
brought to the
it's
hospital.
not. And
I have
you
an
really
uncle.
need to stop saying that, because
Okay.
people,
I have an uncle.
behavior and mental illness, the only focus of mental
Okay.
health is your psychological state of mind. Behavioral health encompasses all things. And that's like saying that because I
I
came
worked
from an
on
abusive
psychiatric,
household,
adolescent,
I
and
spoiled my
adult units.
kids. That's a learned behavior. That
But
doesn't mean that I have a mental illness. And that's why I keep saying you have to separate the two. Just like she said, her little kid that had Down syndrome, he had a behavior problem. And she corrected the behavior problem. That didn't mean that he had a psych issue. Now, do some people with behavioral problems have psych issues? Absolutely. But not everybody who has a behavior problem. If I'm always mad, it doesn't mean that I'm clinically depressed or I'm psychotic. Maybe I'm just, that's a learned behavior, that's my reaction to everything that happens to me. So that behavior has to be unlearned. And this is one of the reasons why people won't go into counseling, because everybody automatically assumes assumes that they have a psych issue and it's just a behavior
true.
issue.
That's not true.
I have an uncle that is
It is
diagnosed
true.
schizophrenic,
It is absolutely
and
true.
he has he was diagnosed that because someone put a Mickey in his drink, and after someone put a
Drug
Mickey in his
induced.
drink, he was no longer behaving the same way he was behaving before that.
I believe I know
It's
who you're
still
speaking
your
to.
behavior. It's still the chemical imbalance affected his behaviors. So now he has a mental problem with the psychiatric, being a schizophrenic, but his behaviors have changed because of that. Behaviors and mental health still are interconnected. It does not mean someone has a mental problem just
You're breaking
because
up.
they, doesn't mean they have a mental problem, but they're still connected to behaviors that are still connected to your mental state. So that's what that's what we're striving to say. We're not striving to say that a person's has a mental problem when they have behavior. When you have your mental state is not in place, your behaviors will change. It's all of it's going to change. Just like this young man had, she said he has Down syndrome. That is okay. So he has Down syndrome.
His
But
behaviors don't change his down.
his behaviors are not going to be like other regular children who don't have Down syndrome. Their behaviors are different. They're slower in interaction. Their interactions. I have a cousin that's Down syndrome. She does not operate mentally, nor do her behaviors operate like my other children would, or other children would act that do not have Down syndrome. So it is affected in two
But you're
places,
using an
behaviors
example.
and mentally. They're both affected. So you can't separate
You're
the two.
using an
Yes, you can
example of
separate the two.
chemical.
Ask
So
any
how
ask
You're
any
using an
psychologist.
example
They'll
of a
tell you
chemical
you can
being
separate
added
the
to
two.
something. Go ahead, Rebecca.
No, it's all good.
I wasn't, but
I
plus
was
I wasn't
saying
finished.
that
I was
you're
I'll
using
give
an
y'all an
with
example.
say it
Give y'all
again.
an example of how it can be different. So
Okay.
when I was a
Please
kid,
do.
I was out of control with my behavior in school. Like I would get up in the middle of class and walk around and sing. I would get up and go sharpen pencils for 10 and 15 minutes. Like I knew what I was doing was wrong. But you know what the problem is? I didn't have a behavior problem. I was just bored as shit. I was bored. And everything that my teacher was going over was stuff that I had already learned at home, that my mom had taught me. I had already learned. I started school in kindergarten and I could multiply already. So look at, here I am in first grade and my teacher's talking about 1 + 1 and I'm doing multiplication in my head. So here I am. Now I'm talking to other kids. I'm drawing. I'm doing everything outside of what the expectation is because I was bored. And it's like I would go home and tell my mom, like, my teacher would call my mom and be like, "Oh, Latoya was talking and this and that." And I told my mom, but I don't know what else to do. I'm bored. She's talking about 1 + 1, and at home, I've already learned 12 × 12. It didn't work for me. And it wasn't until they actually sat down with my mom and found out that I know all this shit. And before they even called my mom in, they put me in and tested me to see what the hell my problem was.
Am I who?
Nobody said
what my problem was.
nobody.
So, I didn't, and it was clear. I didn't have any kind of mental disorder. I really didn't even have a behavioral problem. I was just bored as shit, and they had to figure out some other way to deal with me, and that was it.
I had that with my oldest. When he was younger, because he was very active, they wanted to put him on Ritalin because he was very hyperactive. But I said, no, we're gonna work with him. I'm going to put him in football. I'm gonna put him in a sport that he can let that energy out. And he did that. He's no problem, boy, fine. He's fine. You know what I mean? With his mental state, with his behaviors, it was all he's fine. So that's what I'm just saying, that it just kind of okay. So Brolic T, you just said and please help me understand. I'm really striving to understand. I'm not trying to be combative. I want to understand what you guys are saying, but I just don't see it the same way. I'm trying to understand because when you were saying
So
you were bored,
I
and
was
so
bored.
then you start saying you're bored. Now you're trying to, now you walking around, you're doing stuff, but
I
that
was
goes
doing
into,
stuff to
but
That was
keep myself
behaviors. That was behaviors.
preoccupied.
right. But you were meant, but you had to think about this thing though. You're sitting there and your mind is like, I'm bored. That's mental. You're thinking your thoughts.
No,
Mental.
I wasn't. No,
Where does
I
mental come
wasn't
from?
actively thinking that I was bored. I would just do stuff because it's like, okay, when she starts talking about something that I don't know, then I'll start paying attention. But in the meantime, I'm gonna go do this
You
and keep
thought that
myself
though.
busy.
You thought
Where
that
does the
though.
mental
Until she
start?
said she got kicked off. Can you add her back on,
Okay.
please?
Where does the mental begin? Like where does mental
The
come from?
mental began when my mom would ask me, well, why are you doing this in class? Because I would unconsciously do it. It wasn't something that I ever did out of malice or just because. I just did it because it would
But mental
keep me
doesn't always
busy.
need to be
It
out of
was something
malice.
to keep
Mental
me
can also
busy.
be good mental state. You could be in a good mental state. You could be in a peaceful mental state. You can be in a calm mental state. Mental is not just bad, it's also good.
No, I'm not
Be
saying that it was
right.
bad. All I'm saying is that it wasn't something that I was like. I guess what the misconception may be is that some people think that mental health is always that people that have mental issues are always cognizant or that
Right.
they know what they are doing. Not everybody knows what they are doing. When I was misbehaving, I wasn't really looking at it as I was doing something wrong or something bad. I was doing something to keep myself preoccupied.
Yeah.
Who is
So
that
But
that
thank
put
you,
that?
Anita, too.
Listen,
So,
Hmm?
Lakia,
listen.
I wanted to, if possible, I
I
wanted
don't
to
know who is that
respond to
talking.
this
Herb.
Tiffany. It's
It's Herb,
me.
ain't it?
I know it's you talking, but I thought that black spot, whatever that is, was talking.
It's
Oh, I
Herb.
heard
That's
that,
what I'm
that additional noise
No, I'm
too.
saying I
Okay,
couldn't see anything, and I could hear a voice outside hers, and that's why I was like, "Who else is talking?"
I haven't
right.
put
I
up my
thought it was somebody's phone echoing.
no, I haven't put up my screensaver because I'm riding back home. I didn't read my schedule, so I'm headed back home.
Who
So
is
y'all can
that, David? Oh, sorry, go
don't
ahead.
let me know.
That's her.
Who is that said, look here, remember when community mental health was changed to community behavioral health, which is true because I worked on the outpatient mental health floor and it did change the name.
I don't
No,
know.
but
I only
not
could
in
see
it.
it as Facebook user.
I know
So somebody that know that I worked in mental health
was
before.
about your uncle, and that was an unfortunate set of circumstances. That brother was robbed. Somebody should have paid dearly for that.
Who? Oh, my
The
Uncle
point
Robert?
that I was trying to,
Yeah.
yeah,
Yeah, my
I
Uncle Robert.
wanted
I
to
know. And
address.
then the thing with him, my grandmother, she ran herself crazy trying to find help for him because he had a drug addiction on top of it. So now he went from, running out of different type of mental institutions, and he tried to help him, but finally now he's out in Ransomville, away from everything, and now he's been doing very, very well. But
Yeah.
it took a long time. It took a long time to get him into some place to help him be stabilized.
When something is introduced to the system like a chemical, it can change the neural pathways. Once those neural pathways are changed, it becomes a psychological issue because it affects the psychosis. There are people who have mental health, real defined diagnosed mental health issues that don't have irregular behaviors. So anything that affects, Wally T, you were talking about your experience as a kid. I had the same problem with my son. When he was in fourth grade, he was doing 11th grade work. And so he's done with his work. He's well ahead of the class, which they didn't want him to be. So now there's nothing left for him to do. When I met with the teacher, this is what I said, there's nothing left for him to do. Why don't you allow him to tutor the students that are having problems? So now you have in class help And now his behavioral issues are curbed because he ain't got nothing else to do. So if you don't already worked ahead, he had pretty much finished the textbook already. And not to mention, he's working at an 11th grade level in elementary school. And they're not going to teach you, well, at least then, now they may have curbed that. They did not want you even working ahead of the class, let alone teaching you on a higher level. You know, even in the gifted classes he was in, he was always ahead of them. So if you become creative in using certain things, that behavioral problem you're complaining about was able to be curbed. That was not a mental health issue. And
I
it was
don't
not
see
a behavioral problem that we saw at home, because at home he was taught on the level that he was at. But when you're in the school setting, because there are a number of other children, they try to keep everybody on the same page.
Well,
Anything that
see,
affects, like Rebecca said, that affects your psychosis, your psychological functioning, is the root of a mental health issue, not the behavior.
I don't think it was ever said. When I said thoughts, feelings, and behavior, that don't mean I'm classifying as, oh, this person has a behavior issue or this person has a mental health issue. I know that those three, they go hand in hand. Thoughts, feelings, behaviors, then there's actions based on that. And I could tell my story that they wanted to put me in special ed because I never said anything. I never answered. I never participated. I was quiet and reserved. And they had a parent teacher conference, and it was like to my mother, Miss Glover, we don't know what David knows because he doesn't talk. He doesn't say anything. And she said, well, did you ever call on him? You might have to call on him because other than that, he may not say anything. She said, but trust and believe. He's smart. He knows this stuff, whatever. He does all this stuff at home. He may not just say it at school. So the teacher was pushing that down. My mother came home. She said, listen, either you start talking or they're going to put you in them smaller classes and you might have to ride that little bus to school or whatever the case is. And I'm like, small classes, little buses, like, no, that ain't going to happen. I went back to school the next day, and granted, I never said a word in the class. And the teacher's like, good morning, everybody. I said, good morning, Miss Crabapple. And she was like, what? And I was like in the second grade. So she must have called my mother. She was like, you know what? I don't know what to say. What he called me wasn't a good thing, but I was just so happy that he said something. And then from that point on, I took off in education because I'm like, wait a minute, this woman trying to shackle me, like trying to play me, whatever. Then I start getting active, whatever. But my mother said, you need to call on him. You need to call on him and he'll talk. Other than that, he's not going to say anything. Yeah, they could have said, he's crazy. His behaviors, he don't talk, he don't say anything. But I was just quiet. All I'm saying is thoughts, feelings, behaviors, all that stuff is connected. And I'm not even looking at the mental health or breakdown, behavioral health, mental health. I know those things go hand in hand.
The only reason that I was making that distinction is because there are parents and there are people who are watching. So we want to be able to give you some amount of tools to measure whether or not this is a mental health issue or a simple behavior issue. So that's the reason why I was making the distinction. Because if you don't, or somebody who is a parent to be, or, you know, whatever, you have to be able to, at least at home, be able to tell the difference between a behavioral issue versus a mental health issue. And that's the reason why I think some of us are trying to say that they don't necessarily go hand in hand, because you have to be able to identify it. The teachers need the parents to be better, and so on and so forth. How do you do that? You help them understand the difference between this is a behavioral issue, go get yourself together, versus this is a mental health issue. Let me get you some help to get you together.
You know what? Let me jump in and follow that comment up. And I've done this for a number of our kids that have fallen into trouble. What I will tell people is, if you're struggling trying to find out which is which, get you an advocate. They don't have to be paid. They just have to understand how the system works. And once they understand how the system works, if you allow them, they can be an advocate on behalf of yourself and the student to get those resources allocated to you that you need so your student doesn't fall through the cracks of whether it's a behavioral issue or a mental health issue or a component of the truth, that child, especially if they're young enough, they can get redirected and get set on the right path, similar to what David's story is. So when they get to be in middle school and on into high school, adjusted so they can function with their peers. This is what this is all about, is getting somebody to function in what society considers to be a norm. And if they can function inside that norm, then when they get to adults, what are the other issues they might have that might be underlying, they can address, whether they address them, quote unquote, on their own or they seek additional help. That's what the baseline measurement should be, at least in my opinion, is to get them to a level to where they're set, so where they can function in society as an adult, so they don't go off the hinge when something bad goes wrong. They don't, like Rebecca talks about, the psychotic snap. They don't get there. They say, okay, wait a minute, I'm having an issue with such and such, and I'll use myself as a measuring tool. When I got the text that my mother died, it was already expected, because our sister had told us, like a week and a half prior, that she's almost there, so she's just preparing her for it. Now, I already knew she was going to transition at some point, so I mentally prepared myself for the moment that I got the news. I just didn't realize I was going to be at work at 3 or 4 o'clock in the morning. Then I got the text, and I was like, okay, that aspect of her life is complete. Now we need to get through the funeral or the memorial service without people falling apart. And we did. That was because the family was there. So when we went back to my brother's house, there was no tears, all joy. And a lot of people don't have that. And I understand that for them, I empathize tremendously, because there's nothing like familial support. And a lot of people just don't have that. Granted, the way I grew up wasn't ideal for a lot of people, but for me, it worked.
If can I ask this question real quick? Let me ask this question. I even see Judy put in there, and Judy, she said she's also experienced in this field. When there's a chemical imbalance, as we've discussed, if there's a chemical imbalance, and she's even shared, if there's a chemical imbalance in the womb when a mother has a child in her womb and doing drugs or alcohol, there's a chemical imbalance.
They're going to behave a certain way.
Does it affect their behavior?
Yes, it will.
So that is in that, because that's a mental chemical imbalance. And that's what she said. It's a mental chemical imbalance. That's where it begins. And that's the thing that we're trying to say, that. So when it comes to mental health, if you have a good balance, you're going to act what? You're going to be happy. You're going to be joyful. Your behaviors are going to be loving. You're going to be kind. You're going to be chill. You're going to be good stuff. But then when you're mentally messed up, your behavior is going to be messed up. You're going to be cussing folks out, being rebellious, not listening, whatever, doing you, regardless of what's going on. Your actions are going to speak for what is going on inside of your brain. That's all I'm striving to say. If that's not the truth, when is it not the truth? So when will your behavior stay the same when your mental is different? And share, if you can show that to me, then I'm done with it. But I'm just saying, like, where does that happen when your behaviors don't never change based on what you're thinking?
When you're a child, whose TV is that?
Well, it's not mine. I'm outside. But if the underlying issues are addressed,
I'm talking to them. What I'm saying is a biological factor can be measured. If there's, like, for example, if they're a parent who's taking drugs while their child is in utero, when that child is born, when they become of age, they can MRI him, find out of what the brain is functioning to at this level, so on and so forth. Biological factors are, to me, a little bit easier to find out, because if you know that the left hemisphere of his brain did not develop, then you expect certain things. There's a difference when it comes to biological issues. And the only thing that I was going to say to her was, I don't want people to have to get an advocate. I want you to become your child's advocate. Learn everything that you need to know if your child has a diagnosis about that thing, because you need to be the expert. People are only as dedicated to your child as you make them, but you are dedicated. So I would always say for the parent to become that child's advocate, because they're going to advocate for their baby like nobody else will.
I don't disagree, but the problem in that statement is you have some parents that are flat out, they're just lazy, don't want to do the work.
And they won't
And
advocate. Yeah, so
because of that, that's why I
I've been
advocate.
a counselor before. I've been a counselor before, and it's an unpaid position. And people are only as you can only be as invested in that child as their parents are. That's why I said that.
See,
And you're right. There are some lazy parents. You're right.
Disagree because I've been more involved in some kids' education than their parents. I speak from experience, and I understand you do too. That's why I say if you're not willing to do the work as a parent, go find somebody that will. That's all I'm saying.
Yeah. Even when they're your advocate, when you're their advocate, you can only be as invested as the parents. If you're someone's advocate, like you said, you have been an advocate. If the parents ain't tapping you and saying, listen, this is what we want. I mean, there has to be a connection. Like that lady said, connection is everything. You can only be as invested as the parents are for the most part. I won't say only, but generally people are only as invested in someone's child as the parent is, generally.
And see, because let me explain it to you like this. My mother had the equivalent of a 6th grade education. Now, she never pushed us to excel in school. She never pushed us to do well. And if it hadn't been for the people that were running the 13th Street Community Center in terms of not allowing me back in there until I went and re-enrolled in school, I probably wouldn't have. That's what I'm talking about when I say the level of commitment that the community can bring that a parent can't. Because we're all of the, let me not say we're all. The thought process is that everybody that has a parent has a well-educated parent. We had some parents that dropped out of high school that can't keep a checkbook, that can't do certain things. And these kids don't have a choice of who their parents are, but they do have a choice in terms of, well, let me not say they do have a choice. They should have a right to have somebody advocate on their behalf, whether it's the parent or somebody from the community. At a certain point, and this is one of the platforms that I ran on when I ran for the school board, I said, homeschool and community. If either one of those three facets are failing, that student's at a greater risk of not performing. And I will maintain that. This is why last week, when we went out of town to Greensboro for a basketball tournament, and my man tapped me, he said, this is what we need. I said, I got it. I didn't ask for any money because I understand those were things that were given to me off of the back of the taxpayers' dime when I was 15, 16. So I do that in return. I don't ask for anything. We fundraise as best we can. And for those who can't, they're still able to come because I understand that exposure, among other things, is the greatest key for these kids to see that there is something outside of Impoverished Niagara Falls that they can aspire to achieve, to see and go. But in order for them to achieve that, they need the baseline structure that is a diploma. Studies, statistics, and everything else has shown that if a kid graduates high school and they don't fall into certain subsets like being a criminal, having a conviction, or having a child out of wedlock, that their rates of escaping poverty explode exponentially. I am a product of that. This is why I stress, why I mentor, and I know the backlash that I get, and I'm fine with that. But I'm going to stand in the gap for these kids that don't have.
And let me add another piece to it, and I'm gonna get personal on this one. So it's not always chemical imbalances and all that stuff. Sometimes it's stressors, whatever. And I can speak as far as my father. Growing up, I always heard my father was like a genius. He was real smart and all that stuff. He lost. Well, his dad never claimed him because he was too dark skinned. So once my grandmother died, all the great tools that he had went, I don't know, to the Antarctic Ocean, whatever, to the Atlantic Ocean or whatever the case is. And his behavior started changing. He was smart, had a good job. He worked with my grandfather at a plant, and my grandfather used to always tell me, boy, I tell you, if your father would have never got tangled up on them drugs, he was headed to be a foreman at a young age, like 24, 25, supervising all of us. He was that smart. He was that smart. But he let stressors and stuff get to him, which led him to obviously drugs. And then his behavior started changing. But prior to even doing the drugs, he had behavior started kicking in, which led him to obviously say, I want to do something to self-medicate these behaviors. And it didn't work. And he fell victim to that and never rebounded. Had 3 sons and a daughter. And I'm going to be a little facetious. One handsome son, because I know my brother's probably listening. My sister, she all right, whatever. And Dietrich, they're probably like, yeah, whatever. But he had a good family, a loving wife and all that stuff. But he let the stressors get to him. And he never came back from that. So those are the type of things like in family structures that get broken down because certain experiences or certain events cause people to go another way. And it's sad. And it happens all too often with many of us. It could be one little thing that can kind of derail you from being in your greatness. And I heard that over and over. Your father was this. If he was this, if he was that, he can be the greatest drug and alcohol counselor. He would be the Michael Jordan of this if he would did that. That just don't work for me because I'm feeling the impact of him not being able to show us love. I'm feeling that impact now as a youngster, and none of that stuff mean anything. I know y'all know the good guy that was smart in school, the one y'all thought was, that y'all said was a genius, but it's impacting family members. So it's just certain little things that dictate people's thoughts, feelings, behaviors, then it become actions. And they're all intertwined and they all go together. I'm not going to say everybody has a behavioral health or mental health issue, but during certain times, thoughts, feelings, and behaviors and actions lead people to situations that they may not normally do.
None of us dare not invalidate your history. So that's why everyone is quiet. Nobody dares invalidate that because that's a real life situation for you and you felt the impact of that. You're the residue, you know what I'm saying, of something like that. And those things are impactful and they can impact you negatively or positively. My cousin's ex-husband family, his mother had, I think it was 9 of them, and she was always an addict. As long as I've known her, as long as he knew her. And out of those 9, I believe it was 3 who did not become addicts. 3 of them determined that they was not going to live that way, and they did not. Last time I checked, he went from being a pilot to being an engineer. So different things can impact you in a different manner, and sometimes we are the residue. We are the results. You were the results. Some other things that have happened in people's lives, they are the results of somebody and what they done. So it was good to hear you share. You actually opened up the door, and I guess you thought we were going to attack you or something. But today you
was
didn't
ready for it. You already know I want all the smoke. I want
never
all...
smoke for me.
Really? Really?
Never smoke for me.
I want
but
it.
In this instance, there is no smoke to be given because that was a real life matter. And it helped to determine who you became and how you interact with your child. You know what I'm saying? You got a kid, so that stuff impacted on how you do with your own child. So what is to be said?
Yeah, and I always tell anybody, there's no such thing as a perfect parent or the best parent and all that. We fly by the seat of our pants. We try to be the best that we can be. We try to get them through situations or whatever. Some of them, if we based everything on outcomes, even we could be giving them the best knowledge possible, and they do something otherwise. That doesn't mean you're a crappy parent, whatever. You giving them the best you can, and we go with it. We go with it. But there's some people who needs that. They need that mantra. They need that to say, "Oh, I'm a hell of a dad. Oh, I'm a good mama," and all of that stuff. I don't say
I'm
all
the
that stuff.
best
Yeah,
fur baby
That's-
mama ever. Okay.
That's
I don't need all that. I don't need all that,
My
man. I
job
just try
is
to get them
tell
through.
you what you do with that information is up to you. My job
Mm.
is to tell you what you do with it is up to you.
Yeah.
So yeah,
I could show you by example. That's what you see is what you get. And other than that, hopefully we build a bond and you can respect it and we can go from there. And it's all everybody makes mistakes. It's trial by error. That's what life is. Trial by error. All right, folks, whatever. We're gonna get to the point of closing talking points. And we're gonna get up out of here. Great show, great back and forth, and as I can see, we got a lot as far as the behavior and mental capacity. We had a lot of disagreements with that, but it happens. For me, I just think everything is intertwined. Whatever. Sometimes some of the things skip over the other, but they're all connected, very well connected, and will always be connected. Who wants to go first? Closing points.
I will, because I got some chicken wings that are heating up. But
You got some 7-Eleven chicken wings hooking.
no, actually, I got some from one or two places I generally order from. So I have some from last night that I ordered, and I'm getting ready to get some pizza too, and I'll put my feet up because I have to work.
Oh, I thought you had to work. I thought you had to work tonight.
Stretch for it. You see, hey, when the blue shirt is the work shirt. So if you see the blue shirt,
okay.
and that's what I was doing. My man came in, my coworker came in. It's like, oh, y'all, I thought you were alternate. I said, well, check the schedule, because I have a bad habit of not checking my schedule beforehand, which is why I like a set schedule.
That's a mental thing that drove your behavior, Herb. You need to tighten up mentally. You need to tighten up and check your schedule. That's a mental thing.
And man, like I said, this past weekend, man, it was a tough weekend, man. Just to give people an insight, as a black man growing up in this country, there are certain things that really don't bother me. Being called a nigger, by people, it doesn't bother me. I know that might offend some people who might hear this or who are on the panel. It doesn't bother me. But that's what I was referencing earlier when I say that myself and my coworkers have been dealing with this type of distress over the last year. And this is not the first time that somebody has leveled that type of insult toward me. So I take it in stride. But when I get home, it's just like, I have to find a better avenue to where I'm not subject to that type of nonsense. Because people feel free to do things when there's no chance of repercussion. Because I realized that if I had been in a different environment and that was levied against me, then I had the daughter threatening to do bodily harm, that situation would have turned out a whole lot different. And there's a lot of people that think that men shouldn't be putting their hands on women. I'm here to tell you that if you raise your hand to me, I'm gonna put your ass on your motherfucking back. Male or female, I don't care who you are. That's just how that's coming. So those are the type of stresses that, I get at work that I really never talk about. I try and keep them under the rug because a lot of people don't really need to hear that. But that's what we're dealing with in the service industry over the last year. And it's not just myself. I have Caucasian coworkers that are coming under fire for being racist just because people aren't getting what they think they deserve. So, I just want to put that out there. A lot of people think that customer service work is glamorous all the time, and it really is, especially now with people feeling, right to take pot shots at people because, like I said, we try and keep our behavior above board. So I just want to put that out there. But I think this was an excellent show. We had a lot of different perspectives from people that David and Scorpio T, because you're in that environment, you get to see a different aspect. So does Rebecca, and so does Anita. We all bring a different aspect to this. So I think, as long as we walk this earth, I think we have a debt to help somebody if, and I stress if, they're willing to accept the help, because like we've already demonstrated, you can't make somebody do something that they do not want to do. And I think that's the most difficult part that we have to deal with it, and I'll reference my mother's situation again. She was here for 6 months, and it was like pulling teeth sometimes to get her to do just the basic things. And I spoke to my man one time. He said, whatever you do in life, I want you to always keep this in mind. He said, as people, we are twice a child, once an adult, meaning that when we get older, because we've become set in our ways, we have to experience something that's traumatic enough for us to actually ask the power and the control that we have over ourselves as adults. And when he said that, it just triggered another cascading element of or a series of thoughts. And I had to understand who my mother was at her core. My mother's never been a person to take a backseat. My mother has been strong-willed, and I had to go back and understand, where does that come from? And then I had to realize that my mother, born in the early part of the 20th century, was probably the direct descendants of slaves, which were forced, for the most part, to be on their own and strong. So I had to understand life through my mother's eyes and why she would refuse to give up that control. So, I just want to put that out there, and like I like to close, that growth and understanding occurs in the gray area. Godspeed. See you next time.
Appreciate you, brother. Appreciate you. Who's next?
I'll go next because I've been quiet for the past hour and a half.
I'm
and
sorry,
tired.
Anita. I'm sorry.
Well, you guys are talking about kids. I don't really,
Mm.
deal with kids on that level.
Close
But,
it out, Anita. Close it out.
I'm talking.
All right. My bad.
Hey, Anita, I got your back. You see this right here? I got you, girl.
Yeah, look, you see my shirt says power to the girls. Okay. Anyway, so earlier on in the show, I really wanted to touch on, I think that more in the behavioral health industry, human services, and that realm, they need to start teaching more about the stages of change. Because when I was when I was doing my internship at the detox center, I did classes, and I was studying to be a drug and alcohol counselor, New York State certified. So I was surprised when people have been there 2 weeks and been there, there, back, have been through the whole system, and nobody bothered to teach them the stages of change. So if somebody doesn't know or understand the stages of change, how they you don't know what you don't know. That's all I got to say, and power to the girls.
All right, Anita. Much love. Appreciate it. Who's next?
And good night.
Good night.
Because I'm tired.
Who's next?
I do have a little thing that I saw, and it pertaining to mental health. So, what mental health needs is more sunlight, more candor, more unashamed conversation. So that's my closing statements.
All right. Who's next? I got to call on somebody. Brother T. Don't nothing hurt but a lick after midnight.
Don't nothing hurt but a lick. I actually had a pretty good quote earlier, and for the life of me, I can't even remember what it is right now. And I'm pretty sure once the show is over, it's gonna come to me, but it'll be too late by then.
You can write it down, and I'm sure they'll come into play next time.
I know, maybe.
So, could you give us? You got a replacement one?
Come back to me.
All right.
Wait, where's your mom? Let her say hers.
Oh,
Mama T, real quiet. She must got her tonsils removed this evening.
I like her closing statements.
You got a closing statement, Mama T? She said, "Give."
Better for them to think you crazy. They won't fuck with you.
Oh, she.
I'm crazy.
Did y'all hear her?
I heard part of it.
My grandma told her it's better for people to think you crazy because then they're less likely to fuck with you.
Yeah,
Hey,
that's true.
Will
That's
Smith
true.
in The Fresh Prince of Bel-Air, ain't it?
Yep.
People often say, "Oh, don't mess with him. He crazy or she crazy."
Certified.
You already know, man. To thine own self be true. That's it. That's all. Be true. Lie to yourself.
All right, Rebecca.
It was interesting.
Excuse me, ma'am. Excuse me, ma'am. I'm gonna need you to say it as normal.
It was interesting.
Nope. We can't take that from you, Rebecca.
You stay,
That's all I
mind
got,
your
man.
freaking business
That's
over
all
here.
That's all I got.
We back at you. We back at you, Product T.
Oh, I'm not gonna say that one. I don't know. I guess just at the end of the day, just treat people how you want to be treated, and just be a blessing to others when you can be. Just be a blessing to others when you can be. If somebody's reaching out to you and they say, "Hey, you got a minute? I want to talk about something." Take that time to listen. You never know. That could make or break a person's day or their decision. Like, a primary point of this conversation is how people tend to need that listening ear or that non-judgmental ear, and they don't have that person to reach out to. But a lot of times we don't actually take the time to listen to somebody any damn way. So
True.
Just be a blessing to others when you can be.
All right. For me, you know how it goes. We look at these subject matters. We all have our different opinions and perspectives. And for me, I can always think of mentally some of the things that drove my behaviors that may not have influenced my friends' behavior when it was time for us to do corrupt stuff. It was always that voice of reasoning, hearing my grandmother, my mother's voice, two powerful individuals. Who the hell is that making all that damn noise?
I've been trying to figure that out for like the last half
God
hour.
damn, somebody getting their ass beat in the background?
Me? I don't know. I think my son he's snoring in the background. I thought I was on mute. I'm sorry.
So, you always had those voice of reasoning, and I always would think that. Like, even growing up with my friends, they would want to do certain things, and I would say, and I would hear my mother and my grandmother's voice in the background. Don't do it. Don't do it. It ain't worth it. And I would think about it, and I say, do I want the acceptance of my friends who ain't gonna do shit for me, or do I want my caregivers to because I like nice things, I like new sneakers, I like bikes, I like different things. So plus I have respect for them. That was always my mental thing that drove my behaviors. So I would get ridiculed, get called all types of names, whatever, and I would say to them, "No matter, it don't matter. Y'all not doing nothing for me." And they were like, "Oh, we ain't gonna talk to you." Didn't care because I knew they were still gonna come back because I was always solid in what was planted in my head. And I think that's the case with some people. Some people with their parents, there's some kids, they're solid in what their parents planted in their head. and they'll take stuff only so far, and then they'll say, "Damn, what would Mom Duke say? What would Dad say? What would Grandma or Granddad say?" And that drives their behaviors because mentally that stuff is ingrained in their head, and they know only to take stuff so far. But sometimes when people don't have that solid foundation mentally or things that drive them, they don't care. They'll push stuff to the limits. So I'm gonna close it out. If you're listening, remember, there's no more watch parties. Watch parties is done on Facebook. There's no more watch parties. It's over with. So if you're listening right now, just understand, always try to have that voice of reasoning in your head. Somebody, a voice of criticism or something in the back of their head that can kind of help you weigh out decisions. When you have that person or that special person that means a lot to you, sometimes it makes you make better decisions. If you that person to say, fuck the world, then that's what it's going to be. You're going to deal with the consequences at the end. So just think about that. And that's what I'm going to leave it as this. And like I said, these are going to be ongoing conversations. It's never going to be if it was a conclusion to it, that would be us saying we have reached the epitome of a utopian society and everything perfect. But one conversation expound and build upon another. So that's the way it is. I'm out, good people. Everybody enjoy the rest of your night. Enjoy your week. We'll be back on Thursday for something else. And that might be just a specific conversation with a certain issue, and we're going to attack that. And remember, who needs counseling? That segment will be coming up as well. All right, people, I'm out. Appreciate y'all.
Good night,
Talk to you
everybody.
soon. Good night.
Good night, everybody.
Good night.